Oh, the free frozen ground, isn't it? Yeah. Yeah, Preston.
Hey.
How's it going, bud? How are you?
Okay, this is not feeling so well, so. Sleeping a little bit. Taking charge of the kingdom.
Your baby's not feeling well?
No, Casey's not fine. This is the second time in a week she's had a stomach bug. Oh God, it's like the same, that ain't more simply again, that's twice, yeah. That's the one that was kind of got it both times now. She got it.
It's a baby trough. That's miserable.
Yeah. I was thinking that doing a volunteer trip to Costa Rica at the end of the month from school and he went inside the health department and you know, they give you the travel vaccination,
Right?
pitch. Have you guys ever gone to Costa Rica?
Malaria.
If you're going in the
Hi,
booze.
I'm Meeting Owl.
I
To
think
get
I got a
started,
malaria.
download the Meeting Owl app on your
And
phone.
then. Like dengue vaccine maybe too, like yellow fever, dengue. Vaccine. I. Actually Becky set me up.
What she did.
It's like, oh, you're going to Costa Rica, here's like things that you need.
Oh,
And San Juan Basin Health has always been pretty good too,
that's
but it's
where we
not
went.
San Juan Basin Health anymore. so-
Well, it's the same lady that
Yeah.
does the same thing, but she left a lot of it to us, like, it's up to you, you know?
It depends on where in Costa Rica she's going to, like, I mean, we were mostly on the coast and, I mean, it wasn't any different than going to Southern California, basically beaches.
Yeah,
And we didn't go deep into the jungle with the bullet ants and all that kind of crazy stuff,
yeah. Huh,
but I would think very, very much depend on where you're going.
most of it's urban.
You can look it up online too.
I was just curious because you get different. I trust someone that's gone there,
Yeah.
you know, rather than some Yahoo online that says, oh, don't worry about it.
Right. Janet was there.
Yeah,
She went to watch her feed in a river and the locals up on the bridge go, Cocadria. Hi, Cocadria. She looked down, there's about an 8-footer that's coming up about 5 feet away from her.
ooh, wow,
She wasn't even paying attention.
Wow.
Yeah, big river crocs down there.
kid, now you're making me nervous.
Saltwater crocs.
I don't wanna lose my daughter to a crocodile.
I've had a bunch of friends who've gone down there to go kayaking. They've never mentioned the crocodiles.
They're saltwater crocs,
Yeah,
so.
Just,
Yeah,
yeah, right,
estuaries and the
right in
lagoons and
estuaries,
stuff like that,
I mean, but so, like we went to Dominical is really close to one of the big whitewater areas if you're there in season and. I would think you'd be close.
Yeah, they were on a raft and overturned on the raft and, my friend Kathy saw her last bubbles going out of her mouth before she popped up inside the raft.
Yeah.
Really close.
My mom and dad did that too, and they're not exactly young spring chickens.
Did you kayak with Dave Farkas? Is that one of them?
No, I mean, well, I know Dave, but mostly friends from college,
Oh,
who went down there.
Farkas is supposed to be sort of a madman, huh?
Yeah. Among other people, man, there's some crazy kayakers in Durango. Anybody who'd go do the Baker's Box section,
South Mineral
or, yeah, South Mineral's pretty gnarly too, but, Vicito Creek and the Baker's Box of the Animus are pretty,
right?
That could be death.
yeah, I mean, there is no escape. Even Rockwood is crazy.
Yeah, it is.
Um,
Log in?
Yeah, I mean, Michael Barton had a group that was in there and somebody broke their femur swimming in there and it was like an all night extraction.
Just getting them out of there.
Yeah, just getting
That's a
back.
hell of a hike up
We
there.
better start you guys since we have an 8:40
Yeah.
or something.
Yeah.
Let's go ahead. All right, we'll go ahead and call this meeting to order at 8:41. You guys have any questions for the bills and warrants?
Let's see. What's, an EPD bill? It's on 25084. What does that stand for? Midwest Card and ID Solutions. Is that with something with, the sheriff?
Preparing the, its identification badges.
Okay, all right, and just a comment on 25099, the jail bill, that could go up. Is that true?
Yeah.
Okay. Let's see, and I see at the bottom, we got our Bobcat, $50,000 worth, which is awesome.
That's the thing, $1,000 less than before.
Yeah.
That's a good deal.
Yeah, that's the only, observations I had on
Has Colin gotten a chance to get in and use it yet, or
Who?
Colin?
Colin hasn't, no, but it's,
But it's
the guys have, yeah,
it. Yeah, it's behind the shops, so, yeah.
yeah.
We haven't had a big snowstorm, we've probably had to really get out
No.
there and use it yet.
No, we just got it the other day, so
Yeah.
it's a nice machine.
All right, if there's no other questions, I entertain a motion to approve bills and warrants for April 10th, 2024.
All right, I'll make that motion.
Second,
All in favor?
Right.
All right, any questions for our, or comments for our minutes for March 27th?
I like those short minutes.
yeah, very good.
It was a pretty short meeting.
Yeah. To make a motion to approve the March 27th, 2024 minutes.
All in favor?
All
Oh, sorry, second.
Second, yeah.
All in favor, aye. We're jumping the gun here a little bit. All right. Okay, our first appointment is Jeffrey Joyce and Dana for Public Health. You guys like to join us here?
Good morning.
Come on, Mike, thank you.
Morning, back.
Good.
Thanks for having us.
We're actually. You're actually sitting as a board of health.
The Board of Health. Do we have to adjourn and okay.
You just have to blink your eyes 3 times.
Yeah. Click your heels and match.
Together?
Yeah.
Say there's no place like home.
Yeah. There's no place like the miners hospital. There's no place like All right. Whenever you're ready, Willie, we can move to the slides. So my name is Dana Cranker. I know all of you, and I came on board with Becky in 2022 to get us through the community health plan. And we shared that with the previous board that sat here. So Commissioner Meisel, you weren't privy to that, but I'll give a couple summaries. So the community health assessment really was our chance to talk to a variety of community members, leaders, stakeholders, providers, and think about what are the top priorities for health in our community. Who are the partners? What are we working on? What's working well? Where are the big gaps? And so that was in 2022. And then that kind of leads to the public health improvement plan, which is what we're talking about today. And I'll wait for a minute to help us get up the slides so you guys can follow along.
There we go.
We need that for our children.
Yeah. I'm watching you.
Yeah, just repeat it one more time. And we recognize that you all have heard a lot of this, so Dana has really,
Well, and I know you guys all have the slides in your packet, so if yeah.
Yeah.
So put it up on the screen, we can go through if you have them. So
what do you do about that?
Echo.
But you love hearing your voice.
No.
Like
the worst. It's the worst.
It is.
Does anybody like it?
If you do, I think I would probably pass judgment on you.
yeah. I had a grandma, instead of writing letters, she would make tape cassette recordings and then mail them to my mom or mail, she'd be wandering around her house just narrating what she was doing. I think my mom probably has some of them still, yeah. Whether we have the cassette tape recorder to go with it.
Oh,
Yeah.
Yeah,
Or smart, like your kids will go, what's a cassette?
yeah.
Uh,
You feel like we're good? Okay, I won't listen to myself anymore. Okay, so we're on slide 2, talking about what is the public health improvement plan. This is a requirement from the state and actually the feds for public health agencies every 5 years. And again, it identifies the top priorities for San Juan County. It's a document to help guide our funding, our programs, our priorities, always checking back and say, okay, is what we're thinking about this year in line with what we set our priorities for? And it's approved by you all as the Board of Health. How did we get here? How did this document get created? How did these priorities get set? Again, we started with our community health assessment, which was really our data gathering and information gathering period. And then that really helped us highlight some of our big priorities. And then we kind of vetted those priorities through some work groups and some kind of local experts in town. We had like a healthcare task force. We had a behavioral health working group, a resource working group. And that really helped us crystallize, well, what are the actual goals and objectives we could accomplish? What do we really want to focus on? Because, it's a long list of things that might be needed. And what do we really want to focus on? So moving on to slide 4. And you guys have some, let's see, there's some graphs. We have a little bit of time so I can go through them. The graphs on that page, we presented this back when we did the community health assessment, but I think this was just an interesting highlight for 2 of our focus areas. So one of the focus areas is access to care. And this was data that we got from CDPHE, and you can see the dark band is San Juan County. The light band, light blue, is a region, and the gray or lightest blue is the state. And what I think is interesting about that first slide, they have it in there, so I'm just gonna go for it because we have the time. What's interesting about that chart is that the first chart shows that we have pretty high rates of health insurance coverage in the community, at least according to survey data that we have. And people are not necessarily reporting that they're not getting care, they're not going to the doctor because of cost, right? You can see that San Juan County is pretty low in people reporting that they didn't get care because of the cost of care. But that third graph is interesting because it's still showing that we have higher than the region or the state in people that are not getting an annual checkup or seeing their doctor for preventive care. And so the story, and it was supported by the interviews and focus groups we did, is that again, people weren't complaining that they didn't have insurance, although we do have folks that were uninsured, and people weren't necessarily complaining about the direct cost of the care. Really, the comment was, it's just so hard to access, right? It's hard to access locally, it's hard to get down to Durango, it's hard to do that follow-up appointment, it gets canceled because of weather. So that's kind of the first chart that I think is interesting. The second one that was interesting is around behavioral health, and that's a second priority. And it really just highlights instances where San Juan County has kind of worse outcomes or worse reported metrics than the region and the state. And so we have higher rates of binge drinking, higher rates of tobacco use, and higher rates of depression. And so that data really, again, supported what we were hearing in the focus groups and interviews. Okay, so yeah, go ahead.
You see that type of thing in other small isolated mountain towns, I would assume.
Yeah.
Absolutely.
It's a hard place to live.
Yeah, exactly. And I think an important note here is like the county and the commissioners have invested in behavioral health for decades, right? In supporting Bruce and office space. And so I think this isn't new information to you all or this body, that we know that it's a hard place sometimes to live and that we need some extra support sometimes to make it work here. So I want to
See what those figures were winter and summer.
Yeah, they didn't break it out that we didn't, the challenge with local
But these
data.
are the figures for winter or not higher, and then summer is, everybody's employed.
Yeah,
You can get out, you're having much more social interaction because you're all working, different things, whereas, wintertime, there's quite a bit of isolation for folks.
yeah, it'd be interesting when they did the survey.
Yeah.
And transportation is easier in
Yeah,
summer, it's everything's.
Everything's easier.
Yeah.
I can see why.
So I wanted to go to the slide that has the big table. That's really the meat of it. You guys got, a 10, 12-page document. A lot of that narrative is to meet the requirements that the state has for what we have to include. But really, when we think of the public health improvement plan, it's really this table. And I realize there's a lot in there, but we tried to keep it a one-page plan. So it has, 3 top priorities there. Which I'll read are increase access to primary, oral, vision, and behavioral health care for San Juan County residents, increase behavioral health services and utilization for San Juan County residents, and increase access to programs and services for priority populations. And those includes adults over age 60, youth and families, and Latino residents.
What
So,
was our
yeah, go ahead.
average age in this town starting in election?
It's in the demographics. I don't have it offhand, but over a third of our population is over 60.
Eight? Really?
Thank you. Yeah.
Well, nicely done there.
Yeah, but like-
Way to
That's
target
very
that.
subtle.
Yeah,
Last time I checked, I think we went to Fort Lewis.
Well, welcome to our target population. We do have an aging population. So I think in the last 10 years, the median age has gone up. I couldn't tell you the exact age, it's in the document, but it has gone up. So finding supports for people to age in place and just recognizing the challenges that come with getting older in this community.
That's a national trend too,
Yeah.
correct?
Yeah, it is. So we can spend some time here. I wanted to highlight a couple of things, the access to care from the time we did this 5 or 7 years ago, that hasn't really changed, right? Access to healthcare in this community remains a challenge, and there are a variety of things that are working well that we need to continue. And just one thing we did out of this is put together kind of a work group, and Austin was on that task force for a while, and I've kept him updated, is just having the clinic providers in a room, having EMS and ambulance, public health, the school connected to just say, okay, what does the future of healthcare look like here in Silverton? We think about the sustainability of the Silverton Clinic. If Agnes were to retire, think about, we recruited innovation to offer another day a week of primary care, but how will that partnership evolve? Are there other partners we could look to? So I think that access to care, again, it hasn't changed a lot as a priority from one public health improvement plan to the next, but we're trying to continue to think of ways of.
How busy have they been on their Tuesdays? Is it
Busier.
worth their while?
Busier than the clinic at this
Is that
point.
right? Really?
The Tuesday provider, they can schedule through their office in Durango 5 days a week. And they can also see a higher capacity of patients in a day. And that is staffed by 1 medical assistant. And then the clinic, they have longer appointment slots and have 2 people helping. But also are not as accessible 5 days a week. So the provider on Tuesday, if you need a prescription filled on Monday, they can do that. If you need a prescription filled on Monday for the Thursday clinic, iffy. Because that's just what comes with it, of having a provider just on Thursday.
Huh, interesting.
So they've been reporting, an average of payer numbers. I know yesterday they were pretty much full the entire day on a Tuesday, which was nice.
Oh, that's
But then
fantastic.
there's some days they only have a couple patients, just like the clinic, and I expect the summer will get a lot busier for both of them.
Yes.
And then the Tuesdays provider is talking about staying later in the day, and then also bringing up Spanish speaking staff. The issue with that is the Tuesday does cost. It's not a free clinic. And so those, cash pay amounts are pretty high if you don't have insurance. But they're also willing to work with people. So we were just discussing yesterday, the nurse practitioner and I, of just a little bit more accessible ways for them to have patients that may not have insurance, so.
And I think I heard from a Silverton board member that they're also seeing a bit of, the folks who need more of the free or subsidized care might come on a Thursday to the Silverton Clinic, because again, it is free or donation based.
And the continuity of care right now with the same medical assistant, Audrey Rathy, she's so wonderful. We're gonna lose her to nursing school. I think she's our 4th in 9 years. But she is not only available on Mondays for telehealth for the Tuesday clinic, but she's also there Tuesday and she's there Thursday. So that's a really effective way, I think, to serve the community because she knows, she'll say, oh yeah, we can't get you on Tuesday, but we can get you in Thursday. Or she'll do a home visit on Tuesday and a home visit on Thursday for the same provider. So we are gonna lose that and we'll have a person, I think, for innovation specifically that I don't know. And then, I'm not sure what they're doing on Thursdays to replace her or if they're replacing her. Because they still have Jamie Stacy from the school on Thursdays, so. Yeah, so that's kind of unfortunate.
So you're saying you're gonna need another staff member probably.
I don't know what they're doing and it
I
won't.
think they said they hired someone.
Yeah, we won't, we under public health, so we have been subsidizing Audrey's pay on Thursdays only through the COVID testing grant.
Yeah.
So that if anybody needed testing all day on Thursday, it was also just a way of being a partner to them. But that will end
That
in
ends,
of
yeah.
April.
Yeah.
So just per grant funding. So.
I think too, one thing that's been decently successful considering we have two clinics, right? Two providers. There's this need for continuity of care. And these are two new providers, right? Like Lois was that figurehead of people knew her and she knew how to work well with the EMS and ambulance and all the players. And so we convened kind of a work group with both providers, both clinics. Audrey there is kind of the go-between public health, EMS to make sure, are we all talking, what's working well? And I think that was helpful with like Tyler's crew so that they knew, hey, the nurse that's here on Tuesday, she's happy to do a home visit. And so if they have a call or they have something where they can make that referral. And so just making sure we have decent referrals because we're all small and little, but we need to kind of work well together. So that's kind of come out of this planning. But I think just, to put in your brains, because I think healthcare has been something you guys have talked about and thought about, for years. Just thinking we have these kind of models that are working right now, and at any moment, something might change again. It's just kind of sustainability and the partners that we're recruiting and have here.
And the other nice thing too is we also have pediatric partners of the Southwest. They're a wonderful pediatrician group and they come up bi-yearly. So they'll be coming up in early May to do well child checks at the school. And what we do for public health is we really help promote it. But Jamie at the school as a school nurse, she arranges it with pediatric partners. But that's open to all children in San Juan County, including the child care. And that's just an invaluable service. And so in a way, we're kind of like a bigger town with this model. We have, in Durango, they have separate doctor's offices that don't necessarily communicate with each other. And we've been privileged to have, when we have relationships amongst our staff, and when, our personnel, it all depends on the personnel of how much the program is actually utilized. And so we've been fortunate that we reach out to people, we can reach out to people, all of us, I'm talking about you guys too. That's how it makes things tick here. So it's not necessarily abnormal to have the little hiccups, I think, by having two separate doctors' offices or having all these different options. So it's not necessarily a negative.
And with that smallness, you can have, it helps with emergency services, it helps with, office emergency management, so when we worked on I'm not gonna say when they worked on the fire stuff, we had a big fire and evacuations. Because it's small enough and everybody is kind of put together and know those patients who may need special care in those situations. I think that helps too.
Yeah, and it's really, it's kind of being creative too. The provider on Tuesday, I don't know how well it's working yet, but they're working with the purgatory urgent care because we refer to the urgent care at purgatory a lot. They're, really effective and great providers, I believe. And they're only 30 minutes away and they're open 7 days a week. But the provider on Tuesday opened up a line of communication with urgent care to say, hey, if I order the x-ray from Silverton, because I'm already seeing them for something, then would you be able to do it at a lower cost without the urgent care visit? So, you know, those relationships are starting and forming and it's just a process.
Wow.
So I think that's a really, really cool thing. And the pharmaceutical part, it is just, you know, Dana's looked at pharmacy vending machines and other ways just to have, you know, prescriptions up here. There may be something with Durango Urgent Care as well that the Innovation Medical Clinic is trying and attempting with urgent care at, you know, because urgent care does carry some prescriptions, I believe. Silverton Clinic carries some prescriptions. And so I think it's just a work in process and it'll just take a while. But the fact that we have a provider on Tuesday is pretty cool.
Great.
And I think I'll give a personal story of kind of how we keep chipping away at the needs, right? Like I've had kiddos this year who had strep and they needed a strep test, right? So one point with one kid, I went on a Tuesday and then a month later I had to take another kid on a Thursday. And so having that access was great. And then the missing piece is, well, now I still have to go get the antibiotic, right? So I have a positive test. I didn't have to take the sick kiddo to Durango or to urgent care, but now I need to drive there and get the prescription. And so that piece is still kind of the barriers to people filling their meds, getting the follow-up. And
Anyway,
that
you
visit.
could make a deal with like urgent care to bring prescriptions up as far as from Durango to urgent care at Purgatory, so you only have to go, I mean, is there somebody willing that can stop by City Market
Yeah.
and pick up
Yeah,
10 prescriptions
Yeah.
or something like
You
that?
know how it is to ask someone outside for anything, because they're just full up already,
Right.
you know, their capacity is really
Right.
limited. So-
and pharmaceuticals have a lot of regulations around them. And so that's the trick is like, is there a pharmacy overseeing this? How does it work? How do you dispense on site? Is the provider there?
Hmm.
Pharmaceuticals come with a kind of even more regulations than like providing medical care.
This town's pretty good about, you know, what's up on Facebook. Hey,
Yeah.
somebody
Yeah.
pick me up a
Pick it up.
prescription,
Yeah.
or this and that.
Yeah. So I think,
All the time, multiple times a
Yeah.
year, for sure.
Yeah.
Right.
For
Yeah.
people.
Yeah.
And it's really, it's been really pretty easy to deal with. The North City markets especially been really good
Yeah.
dealing
and
They're my
convenient.
favorite.
with
Yeah.
those folks.
Yeah.
And Walmart too is really great as well, but you know, a little further away.
Yeah. Yeah.
Yeah.
So another thing I want to highlight from this table, you know, these are just really setting our priorities. Number one is just the really big thing. And I think what's been important in my role is just making sure that we're convening the key partners regularly to have these conversations. So getting clinic staff in a room, innovation staff in a room, EMS in a room on a regular basis to make sure we're touching base, getting our behavioral health folks all together, working with the school and the preschool. So that's been kind of something you guys know, you have to kind of keep on with that because you might have a great stakeholder meeting. And then if no one like reconvenes it and says, okay, this is what we said we're going to do, that work kind of falls by the wayside. I wanted to point out number 3, like I said, those are kind of the priority populations that came out in the health assessment. And the programs that we focus on there are kind of in a realm of something we call social determinants of health. That's just a fancy way of saying kind of the things that affect people's health that isn't directly health related, right? So it's not necessarily going to the doctor, getting the prescription, or did they have a heart attack, but it's things like economic stability, education access and quality, healthcare access and quality, the neighborhood and environment people live in, and like their social and community context. So things like food, jobs, housing, childcare, social connection in their community, their environmental impacts. Those are all things that actually do have an impact on people's health, right? It actually has an impact on how long people live, whether they have a heart attack, are they depressed or not, but they're not, you know, things that live totally within the realm of the doctor's office or public health. But there's a lot of attention these days to like, hey, these social determinants of health are important. And if we just look at that point in the doctor's office, we're missing these upstream things that are actually impacting why they're here in the doctor's office or what's going on for them. So there's kind of more attention and funding in that category these days, and a recognition that like, we can't just deal with people once they're sick and they're in the doctor's office or hospital. You have to look at those other things that are affecting their health that you don't typically think of in the realm of public health or a doctor. Any questions on this table? This is really the meat of the plan.
Just wanted to make a comment, but I'm interested in seeing in 5 years kind of like where we're at. Again, some of this based on kind of where we've been with COVID, you know, access to
Mhm.
healthcare has been. It has been increased a lot through COVID because the barriers to Medicaid and things like that have been a lot lower. And a
Yeah.
lot of people are losing that coverage, so I'll be really interested to see in 5 years kind of where we are.
Yeah.
As our population ages, how much, you know, how much more people are gonna be qualified and on Medicare versus, you know, those kinds of things, so.
Yeah.
I don't know how easy it's gonna be in 5 years to kind of measure
Yeah.
and examine those things, but,
Yeah.
you know, if we think about it now, maybe there's better ways in 5 years that
Yeah.
we can measure those numbers.
Well, even the graph that was showing access to care, right? If we can get that same data from CDPHE in 5 years that they're measuring, then we can look at, okay, has that changed? In that data point, they were saying access to health coverage didn't seem to be the highest priority, but has it, what I hear you saying is like, has that changed?
Yeah.
Or will that
Will it
change?
change?
Yeah.
Any luck with dental?
I actually, I'm glad you bring it up because you're exactly the people I want to talk to. So I actually had a conversation with a dentist yesterday. Becky and I have talked to the state about this. We've talked to formerly San Juan Basin, now La Plata. We've looked into mobile options, right? Like there's mobile buses that'll come to like an employer and say, hey, now your employees don't have to take the whole day off work to go get a cleaning. We'll just do it at your office. So there's all kinds of options.
We've applied for a huge grant.
Yes, we did. We're hoping to hear next week.
If we get that.
I talked to a dentist yesterday. He's out of Durango. He's actually my dentist and I was there for cleaning and I just said, hey, I also work for public health and we're gonna need dental care in Silverton. You know, would you guys ever think about that? I think building off of innovation where like we just kind of asked around to partners and they said, hey, you might think about coming up. Thinking about that model. So he was very interested. He would be operating independent from his practice in Durango. So I said, okay, we got to kind of put our brains together to think about what this would look like. But he really felt like San Juan County is really part of his community in La Plata. He would want to do this in a way that's kind of, you know, serving the community and accessible and affordable. And so thinking about some model that was like fee for service. So he wouldn't really have the capacity to bill insurance, but he could think about kind of covering his time. He was like, look, I wouldn't be looking to make a profit in doing this. I would just cover my time if I were coming up once a week, once a month.
So we have the service order. What is the demo with La Plata County?
It's for children at the school, which is a wonderful program. I mean, really great program, but they don't extend to adults here.
And that's cleaning and
Screenings.
Cleaning, screenings, fluoride treatment, sealants, preventative.
How often do they come up?
They usually come up once or twice a year and they do at least 50% of our school, which is wonderful.
It's huge. And so it's huge for that preventive piece. What I talked to the dentist about yesterday is that, and when I chatted with Kelly, the school nurse previously, is that it's a great first step, but then you have that kiddo that needs a cavity filled, that needs follow-up care, and they just don't always get it. You know, they just don't always get that next step, especially for some of our Spanish-speaking residents and families. So he was we just started this conversation, right? We're kind of just putting the feelers out there. Is there a provider that would come up? We also have a young woman in town, new family in town, and she is a dental hygienist. She has to transfer her license. And she is very interested in the potential for working part-time. And so it's like, wow, okay, great. We might have these two people, you know, the challenges are equipment. So what would that look like? Could we write a grant? We have some good support from the state on like, what would we need, like equipment list. We have potential space at the Miners Hospital that's been plumbed for dental.
Yeah, I
So,
thought we'd set a room up in the basement
Yeah.
for a
Yeah.
guy who was thinking
Yeah,
about it.
yeah.
I think
So-
it's 2 rooms beside each other, but I don't know if the one room is the only one with the pipe coming out. I don't know if then that's the one that you would do. So, I mean, Lois, you guys remember this, Lois and I, you know, right out of the gates about 9 years ago, we were really looking and we almost got the doc, someone that did dentures.
Oh, yeah.
Was a little nervous that he'd just give us all dentures.
the whole town.
Specialty, and we really, I mean, they even he came with a dentist, like we've been so close so many times. Right before the pandemic,
Mhm.
Kelly Kong, who was our wonderful school nurse for 6 years, She started calling around to all the dentists in the area to try and see who, and she was almost getting one that was interested. So, this grant that we applied for, it's a equity grant, a health equity grant. So it looks at communities that have less health equity. And that one part of that grant, it's $160,000 a year. Who knows if we'll get it? And it would be to really hone in and try to get some oral health care. And whether that looks like one time a month, whether it's one time a week, whether it's one time a quarter, we just want something. I had a dentist appointment yesterday and, it took me 5 hours to go down to, I mean, of course, I did some other errands, just a couple other, like 2 other errands, but it's still,
It's most of your day though.
it really
Any
does.
appointment.
Yeah.
And then it makes me not wanna go and, it's just the same story, I think, with a lot of people. You don't wanna miss work, you don't wanna necessarily go down just for one thing or
Well,
one.
don't wanna drive in bad weather.
Yeah.
You don't wanna drive, and then you have to think about the expense too, and add that gas and whatnot, so it's just very disrupting to have to drive,
Dentists aren't cheap.
Yeah.
and they're not cheap.
Yeah. So I think that's the start of a conversation. I would think that I will be back before you all with some
Mhm.
idea of what some options might be. But we at least have the start of like, hey, there's a provider that would potentially be willing. It's kind of figuring out, well, what does the space look like? What are the equipment needs? The question in my mind is, could he charge a rate and a fee that would be actually accessible to people? Right, because for those who do have dental insurance, are they going to switch over to using him here locally? And for those who don't, is it a low enough cost that they would use it, right? And so kind of that balance of, are people going to show up to use the services, and is it at the right price point for the community?
And the other thing we really added in kind of at the end, after numerous work groups looking at this and talking about it, was, transportation. We all know transportation's a huge issue, but it just feels so difficult to crack that nut. It's just so many logistics with transportation. And then a big part of what we want to do as well as language justice and health equity work with the Latino population, because we really feel like we can do a lot better outreach overall to get access to care for all of our community, not just, English speaking folks. So that's just, we kind of, the third column is a little bit of a lot of things.
Yeah.
So, but, and then the behavioral health program, number 2, we have made huge strides in that the ability to offer free counseling sessions is really great. But we do need a sustainable option because these grants aren't going to last forever. And we also, through a couple of other providers in town who can bill insurance, we see that as, as another option to start trying to bill insurance if it isn't prohibitive for the person to come. Like if they say, well, I have a $50 copay, I'm not gonna do that. Then, so that's just it's a program we have to create. It's not an overnight matter.
It's like Bruce's position is only funded for a year, right?
Actually, we are using the CDC infrastructure grant, which is a 5-year grant, we're down to 4 years. So we did retain funding.
For 5 years.
So we have, I think we have around 4 more years.
Yeah. Yeah, you've been
Yeah.
almost done
Yeah.
it a year, because
Yeah,
I thought the 1 year was gonna end like in June or.
we do, that is a shorter grant,
Okay.
that we do have one ending in June with our other providers, but I really want to try and see how we can continue, the other providers as well of being, paid to see people, so, yeah.
Well, and for the last piece here, I'm gonna put it on the record, public health is not trying to set up a van to take people to Walmart and Home Depot, just for clarification, that was going around town. I think what we're really seeing here is kind of, there's twofold pieces, right? As much as possible, we're trying to recruit partners to provide services here, so people don't have to leave, right? They don't have to go. And we recognize that's not always possible, right? Like some of our older adults, they need specialists, they need care that's not gonna ever be
Right.
here. And so really tackling that transportation needs where there are some health needs where people have to get elsewhere. And even we're just noticing we've done a little bit more work with our older adults in the last 2 years. you know, even just rides around town, like if we were able to set up some sort of transportation program, it could also be local, right? Where one day a week we're taking people to the bank, to the post office, to pay their propane bill, to the grocery store, to the hardware store, just even local options for, we're so tiny that we don't always think about those transportation needs in town. But when we work with some of our folks here, that comes up as a need, so.
How are folks getting to like your Wednesday lunch?
Yeah, great question. So we did offer rides last year. We do this year too, but nobody, I mean, not very many people. No, what's true is there are several people that have left town because of medical needs. I don't want to say left town, that's the wrong word. We have lost several older community members, as you guys know, in the last year, and either to assisted living in Durango, to Grand Junction for care, etc. So a lot of those members who needed rides are not here currently.
Or they get support from friends, you know, so it's
Yeah.
like someone else up.
But we, you know, when we started this, you know, kind of trying to help feed our seniors, last November. I had, I think, around 10 people or 8 to 10 people that we would deliver meals to, and as you guys know, that's down to like the 2-ish or 3 that are really homebound. We've lost a lot of wonderful people, so either they passed on or they moved out of town. And I know we all know who we're
It'd be
talking
kind of
about.
nice, I mean, it'd have to be warranted, but you had a bigger population like that, it'd be nice to have a little van that could
Yeah.
go around,
Yeah.
pick everybody up, and then
Yeah.
say, all right, one day a week, we're running down to
Yeah.
City Market. And,
Yeah.
and
Well, we can't necessarily do that because we do want to also help support the local grocery store and the local
Oh, I see what
hardware
you're saying.
store and.
Sure.
Yeah, so that's a little, if there's something down there that they can't get here, that's one thing, but. But, you know, what we would want to focus on for transportation is medical appointments
Hmm.
and prescriptions. And if they just need to get out of town, just.
The social, you know, Carrie's talked
Yeah.
about this for years of like, let's take people to a play.
You know, I think talking about transportation is really,
Mhm,
I mean, you know, as an older population,
mhm,
it's gonna get more and more difficult for some of these people that are over 60,
mhm.
to drive to appointments and
Mhm.
stuff, and, I mean, and it's one thing to drive to a dental appointment, it's another thing to drive to something where, I mean, you might be able to drive there, but because, it's an eye
Yeah.
thing,
You
or.
gotta-
Can't drive
somebody-
back.
You know, you can't drive
Yeah.
back, and,
Yeah.
and if you don't have somebody to drive you
Yeah.
back.
Yeah.
That becomes an issue. So.
Yeah, we also heard from EMS that like, you know, there are instances where they have a call, that person really needs to go to the hospital or be seen by a provider, but doesn't necessarily need ambulance transport. But yet there's no one to transport them. And so we end up having our ambulance tied up, doing kind of non-emergent transportation, when really if we had options of a resource to call, then we get to keep our EMS here in town for, you know, what potentially is an emergency.
Plus, they also take people to the hospital and they have to drop them off, so they get back to
Right,
town.
and then that
They're
person's
gonna
back.
get back.
That's what I was
Yeah.
saying, mention too,
Yeah.
that happens
Yeah.
more often than,
Yeah.
than
Yeah,
than we probably like to think about, but.
Yeah.
Yeah, but
I
somebody
would,
that's stuck in Durango or somewhere else.
I'll go to Durango to pick up an employee, and that employee didn't realize there were 2 hospitals on the western slope, she was in Montrose.
oh gosh,
I was very
Yeah.
unhappy.
yes,
Took
Yeah.
most of my day.
yeah, yeah. Well, and I know we want to move on, but just this idea that there's also, there's transportation providers that are technically kind of required through Medicaid to cover San Juan County. And so something we've been trying to pay attention to with Region 9 and others is like, okay, have we ever seen that transportation
Never.
provider in San Juan County? Are you actually providing the services that you're supposed to be providing here? So we're trying to tackle this from multiple angles.
Yeah, Shaq mentioned that.
Yeah.
when we were at Anvil the other day, that
Yeah.
people are taking funding for providing that service to San Juan County.
Yeah.
For providing
Yeah.
services to San Juan County and not Not follow.
provide that.
Not.
And they don't wanna do it because they have to drive from here. because
Right.
it's not-
So
they can-
like, if
and
we
then
could
back up, so it's
localize that
double
funding,
trip, Yeah,
it's not the double trip deal.
Yeah.
So I think we're trying to tackle this from multiple ways. What can we do homegrown? What resources can we get here? And how can we just
And-
crack it?
Why do- Karen.
Yeah,
yeah,
Yeah.
one, yeah.
And it, you know, she just couldn't make it work.
well, you have huge lags in getting Medicaid reimbursement, right? You provide the trip 1 month and it's like
Well,
months
And
later.
I don't think that that was her business model. I think her
Yeah.
business model was she thought she'd be going and picking people up at the airport in
Yeah.
Montrose or
Yeah,
Durango to come up and do skiing at Silverton
Yeah.
Mountain or, you know, whatever it is.
Yeah.
And then I think it was more or less that like she was mandated to do that.
exactly, as a
As
provider,
a
exactly.
provider
Yeah.
and not getting appropriately reimbursed, and it was just like
Headache.
the headache and I mean, lack of proper reimbursement for it.
Yeah.
And things like that
Yeah.
became big issues.
So we're looking at that need. I want to move us on, really celebrate success. You can see in this chart here, you know, there's a variety of things here that were already in place, like the health fair that had happened for years that we're just trying to find ways to keep continuing. We had a really successful resource fair in the fall where we brought in a bunch of families, did a carnival, and also brought in the resource providers, right? Because we see a gap and people don't always know what services or things are available to them that they could take advantage of. We've brought in some of these more supportive services like insurance enrollment support, tax help, make sure people are getting their tax credits that they qualify for, bringing in DMV to go, right? These are all things that, again, they're not totally directly health related, but they're just resources that we know are available to people that sometimes you just have to ask and be like, hey, can you send someone up here on this date? And they make a big difference for people not having to go down the valley. The senior meals and senior yoga, the mobile market was a big success. We're bringing that back once a month, May through October. And that had no income qualifications. And again, we have the lowest median income of any county in Colorado. And so even for folks that may feel like, well, I don't qualify, you know, an extra bag of groceries for the month, it makes a difference to a lot of our families, regardless. So that's some of the successes I just want to highlight, especially coming out of the pandemic. And then you might be thinking, okay, funding, where does all the money come from? So talking about Bruce's position or elsewhere, this is just a chart Becky and I put together. You can see kind of the amounts, the grants, the staff it supports, and the public health improvement plan priority that it addresses. And the SDOH for the priority is the social determinants of health. And I think this just highlights like the resources that Becky has really been able to bring in to address these priorities. Public health is primarily funded through grants, and a lot of that's through CDPHE and other smaller grants. But really, this is kind of where it shows up on your guys' line item, but coming from CDPHE. And some of it is kind of set, like core services, right? We're always going to get some core services funding. That amount can change, but that's set. And then these also represent some competitive and non-competitive grants that we've gone after to kind of tackle it. And I think being a small, scrappy county and small, scrappy public health department, we're sometimes able to make arguments for where we might plug in different funding to address a need that we have. So that's the funding piece, and all this requires partnerships, right? And we're really lucky that we can have great relationships with Silverton School, the preschool, the local clinics, EMS and ambulance, law enforcement, social services, and some of our regional partners. And I think my grant funding has helped us kind of connect with more of the down the valley folks and say, hey, we're here, we're at this table, I can attend this meeting, and don't forget about San Juan County. That's been helpful. So, yeah,
How
go
many
ahead.
of these grants take a match?
None.
None, all these are just a straight,
Mhm.
wow. Okay.
I think the other thing to point out though is that, right, pre-COVID, there wasn't a whole lot of effect. So
Mhm.
that
Right.
really loosened up
Mhm.
the faucets.
What was my budget? Like $120,000 pre-COVID
Yeah.
total? And this won't last forever.
Well, yeah, I mean,
We're running with it while we can.
that's the point I'm trying to make.
Yeah.
You know, right now, we've got great funding and hopefully, you know, there'll be other resources over the years, but if state and federal, budgets tighten,
Mhm.
you know, that money gets
right,
turned off and, you know, obviously we don't have the resources to
right.
fill most of those gaps.
Yeah.
Yeah, and the one thing that's missing on this table is what La Plata County Public Health Department is doing for us, and so they're doing the radon program and the child fatality review program and the environmental services such as the septic and vital statistics. So that's not necessarily on this table, but and then CDPHE is doing the retail food inspection. And that does not cost us, it does cost business owners for some of it, but so any funding from the state goes to them to do these things. And then we will find out at the end of the year how much it will cost us to pay La Plata County Public Health for some of these services. But as before, it was around $11,000 a year to pay San Juan Basin Public Health for some services. We believe now it will be a bit less because La Plata County wants to just do kind of pay on demand or whatever, you know, for exactly what services they provide to us versus a per capita fund. So,
Well, that's a great transition to the looking ahead of sustainability, right? How to sustain this, how to think about the partnerships, future of Silverton Clinic, future relationship with Innovation Medical Center. My position is grant funded. You know, Tyler's come before you guys talking about health facilities, that kind of stuff. So just thinking ahead of like, okay, we're making a lot of great progress. There's funding out there and how do we keep tapping into it? I want to leave us with a last quote from our very own Carrie Metzler. This came up when we did the community health assessment, that little things are going to add up to big things. And I think we, you know, even just having this public health improvement plan, this allows us to go out and sell it, right? We say, hey, we have a plan. We've done all the work. We've done the groundwork. Will you fund this? We have all the people in place. Can you give us some money to do that? And I think that's a great example of just how we can take little things. We can take the work we've done and show that we're set up to access additional funding or work with partners to set up programs. And so we just keep trying to demonstrate the success and the capacity and then turn that into additional partnerships and resources.
So we need your approval on this for the state, for you to sign off on it.
You need a motion on that, Willie?
Yeah.
So we make a motion to approve the health plan as presented.
Yeah.
Is that okay? I'd make a motion that we approve the health plan as presented today.
I'll second
All in favor?
All right.
it.
Thank you.
Great. And then just a signature. And yeah, if you guys have more questions, let us know.
And then we have 3 minutes. I'm gonna do a couple of announcements for you guys. We do have this is our, as I talked about before, the health fair that we are creating on our own with great assistance from the Silverton Clinic and Innovation Medical. Silverton Clinic is going to be doing blood draws. And the incredible part about it is they're doing CBCs, CMPs, which means your blood counts and, you know, white blood cell counts, and then also your liver, your kidney functions, all those. Also, I believe cholesterol, and I think hemoglobin A1C, which tests for diabetes, but they are doing a bunch of blood tests. This is Thursday, the last Thursday of the month, from 4 to 6 p.m. in the school gym. We will do vital signs. We'll have someone from Innovation Medical Clinic coming to do a study where they measure the vascular flow in your, I believe, extremities, only I don't really know a lot about it. We just talked about it yesterday. And yeah, for $25 or less, you can get an amazing panel of blood work. You do not need a doctor's order because this is a health fair. I'll be doing immunizations and vaccines, and the EMS will be doing the vital signs. And so it's just going to be kind of an abbreviated version of the health fair that 365 has done. I do need help spreading the word because I forgot about the banner and just ways of, you know, letting people know it's also at a different time. It's not a Saturday morning. The reason we changed it to an afternoon is we're hoping to get just a little bit of a bigger population that may not come out at 8 o'clock in the morning to do things. So
Tell your employees, it's a great chance for them to get some
Put the
things.
posters in windows.
yeah, I've already put them around town, but if you need more, I will get them to you. We will have translation available. Spanish translation, and yeah, 4 to 6 p.m. in the gym. And
Some refreshments, and I think there might be a dermatology check, so if that was on your radar, Dr. Brooker might be doing checks.
And then there's also one of the innovation medical people, it's owned by a podiatry office, and so they are probably gonna be doing foot care as well. I will fine tune as soon as I get the definite word of the advertisement, so lots of great services. And then the DMV to go. This came last year, it's not really a bus, it's just a car that shows up, and they provide renewal of licenses, new licenses, transfers of license. They're coming May 17th. Sorry, 14th, May 14th and September 17th. And so they'll be here from 8 to 4. I could not get them for the evening, because I know they're trained workers, but they are still a government agency that does not work after 5 o'clock or 4 o'clock. And there will be,
They're still here before the train shows up.
Yeah,
So
yeah,
I-
people,
I-
yeah.
I-
Check all your licenses.
Perfect.
Mine had to get renewal. I had to get an
Yeah.
eye thing. It was
You
a
have
big
more of
deal. I
those
had to get
posters?
Montrose.
yes, I can get you more if you
Yeah,
want.
we
I've
definitely
already.
need those.
I didn't start hanging them up because I had already hung a couple things up the other day and I didn't want people to get overwhelmed.
Yeah,
So,
So
that's an amazing.
Thank you.
Yeah.
Listen, I'll just share why I had to get my license renewed. I tried to stop in Montrose to get it renewed because I realized, looking at it as I was leaving on to go to Montana, that my license was about to expire, it's gonna
Yeah.
expire during that trip.
Yeah.
So I tried to stop in Montrose,
had to have an appointment.
had to have an
Had
appointment.
to have an appointment.
You do
Yeah.
not have to have an appointment for this.
So-
You can just walk in.
But I was able to sit and do it online
Yeah,
without having to get a new
Yeah.
picture because it hadn't been,
so
you know,
long. Yeah.
whatever time. So that was
I think,
okay, but I was like, really?
Yeah, I
For
know.
the DMV?
and we're gonna
we-
have Spanish interpreters there as well.
So
Yeah.
Compañeros is our wonderful regional organization in Durango, and they really offer a lot of resources for our Latino residents, as well as translation, as well as advocacy. They do a lot. And in Manna Soup Kitchen, Lisa, who's been helping us out a lot, will be here as well from the Manna Soup Kitchen. So
Thank you.
so they will be at the DMV because a lot of times there's just misinformation or prohibition for someone to get a license.
Or
who
an
doesn't
ID,
think they can,
yeah.
or an ID, who does not think they can. So please, thank you, Willie. And then, the other thing I wanted to showcase was, CDPHE. I contacted them and it was beautiful. They immediately got back to me. And so they're gonna be doing our food safety classes that some restaurants need for their employees. And so that will be May 13th and 14th. I'm waiting on a flyer, and we'll hold it in town hall. So if you remember, they're taking over for San Juan Basin Public Health again. So they will probably do some food inspections during that time. I don't know. I know, my husband's gonna have to
Participate.
figure that one out with the Gerties and fudge. So I hopefully will understand the process better after this year.
Yeah. Just when they're here this year too, they have a manager's requirement for food safety too, that somebody has to be a food safety manager in addition to the food safety classes. And that is a real challenge, speaking of getting it done. Last time I took it, I think it was 3 days in Durango.
They offer it online now.
They did.
I heard this.
Yeah.
Well, that's good. Well,
Yeah.
But
there,
it's
and there
still-
was a portion of it that you could do online,
I think,
but you still had to show up in person for like a day or two.
So I'll
But-
Deanne, we can put it
Yeah.
out to the businesses, the chamber, and then do you have Troy Huffman? He is our main.
Yeah, and I'll talk to Troy, I'll
Yeah.
talk to Troy when he's here, but if we could get one of those classes
In
here
town.
in town, or, the
Mhm.
in-person portion of it here in town, that would probably really
I'll
help
email
make
him.
sure that people are compliant, because definitely when I went to this class, I think my license expires like next year,
Yeah.
and
Okay.
this year, so it's not,
Yeah.
it does last for like 3 years, they don't have to come
every year.
Yeah.
every
Probably often
class
during
necessarily,
train time.
but.
Yeah.
Yeah,
Yeah.
but But if it's a state requirement as a food service establishment that you have that certification.
Mhm.
So, I mean,
What if we did that during the winter when there's not a train? Oh, because there's a lot of.
There's a lot of businesses not here.
And these
Yeah.
classes we're doing like on the 13th from 4 to 6 p.m. And then the next day, the 14th, we'll do from 8:30 to 10:30 to try and do it outside of the train. We will
Mhm.
also pay for translation at the classes. One day we hope to get the headsets where people can wear headsets and someone speaks through them. So that's on our list of to-dos too. And then last but not least, our meals at the senior center are coming to an end. The last Wednesday of the month will be the last meal. Thank you, Manna, for the food. We had to do little adjustments in what we asked to receive because rice doesn't heat up that great. But things have been a little better the last 2 weeks with just different types of food. And then, you know, the rest of us, Dana's there, Cassandra Roof, Carrie Metzler, and myself, and Lois actually still really helps. And we, the most we got for several times deep in the winter was like 20, probably around 20 to 25 people that were showing up. Now it's around, I think 15 that show up in person, and then we deliver around 5 to 8 meals to people who may just not want to come. It's not that they can't get there. They may just not want to come or they're working. And so people who are participating actually go and deliver meals to people, so.
And I think that's been a really small example of a great success where we were able to, get partners to provide the food. And a barrier last year was we didn't have an oven in the senior center, right? And so like Becky and Carrie are trying to go to their house, reheat these big serving pans, transfer the pans, bring it over, keep it hot, put it in crock pots. And we actually were able to leverage an El Pomar grant that we got referred to from Kim White that said, okay, because with public health, like we can't install a stove with that kind of funding, but we're able to leverage this pretty flexible funding from El Pomar Foundation, which allowed us to put propane, have a stove, get some heating trays, warming pans, and that's like a game changer.
Yeah,
And then it
it's
also
oven.
means that the oven, in an emergency, it's a resource there that it's a propane, you could light it, you could cook food if you needed to. So just leveraging small amounts of funds with things we're already doing is.
So that program I think has been really successful. We all bake cookies and bring salads, and so at least if the main meal isn't quite as what we desired, it's people come for other
It's the
things
social
too.
And
And they talk about the social. So today we will be having meat spaghetti. I need to go over and stick it in the oven here shortly, and I'm gonna be baking oatmeal cookies and grabbed a lemon meringue pie yesterday while I was in Durango. So feel free to come on over. And then the last thing is so you guys know the respiratory precautions changed, or the isolation for COVID changed. The recommendations from the CDC, and this happened a little bit ago, about a month and a half ago maybe. But to explain it simply is that if someone gets COVID or RSV or flu, it's all respiratory pathogens, right? Then essentially they want people to stay home when you're sick. If you are feeling better and have not had a fever for 24 hours, you may return to work. It is recommended that you do the precautionary, if you're still having symptoms and you're still sick, but you're feeling much better, to wear a mask. Make sure you have good ventilation in the place that you're working in. So obviously if someone's working outside, it's a different ballgame. And vaccines are still the key to prevention and hand washing and ventilation and good air quality. So I just wanted to pass that on to you guys that, there's no longer the isolation, there's no longer the quarantine. The precautionary measures after you return to your workplace or whatever, they recommend 5 days. But as you can see, there's no set isolation, for 5 days. We still have plenty of free COVID testing. And we still will, push the RSV, flu vaccines and COVID vaccines because they have recommended another dose of a booster for people over 65. If it's been 4 months since your last, and I absolutely believe in them, they do work, so. And the Miners Hospital, I know you guys know what's going on there. I showed up, it was 55 degrees in my office, but Colin's doing the best he can with what he has. And I just applaud him right now. He's doing the unthinkable and he's coming back every hour to 2 hours to fill the water, and he can tell you more about that. But I call our boiler Mary Ann, and I just don't think she's gonna, well, you guys know. You guys know she's getting tired. That
Yeah.
furnace, so
we're,
I know you're working on it.
yeah, it just,
Yeah,
the engineering firm still hasn't come back to us with their final plan yet.
No, and I got over, David Singer the other day, to rattle their cage, and
Yeah.
apparently the guy that had been working on ours left, so.
So it kind of shuffled into the
Oh.
bottom of somebody else's stack.
Yeah.
well, fortunately, we have beautiful sunny days and it's gonna be the summer and. You know, I think we do just need to recognize Colin's hard work, though. He's, doing the best he can, and it is a really hard job, I think, to begin with. So, yeah, I just hope you can give him a pat on the back when you see him, because I think he needs that. Needs that. It's a lot of work, so. And then what we do is we just turn on heaters, the little space heaters, and maybe wear our jacket for a little bit longer, but it's not a big deal. It's not December and dealing with this,
Yeah.
so.
If he's going manually filling water too, it's not the easiest plumbing job, but any kind of, normal plumber should be able to set up what they call a water makeup.
I would defer to Pete. I'm sure Pete,
It's a different situation than that.
Yeah.
If he's having to go back every 2 hours and because we're losing so much water. It's not a regular plumbing makeup thing.
Yeah, but you can't, like, they set up like a valve with, because a lot of these systems have just pressure reliefs too, and so they lose the pressure anyway for the water. And then but you set up something basically that's like tied into the plumbing that. when the
Just
pressure-
feeds it when the pressure.
Yeah, gravity feed or something.
No, it's like it's a little more complicated, but yeah, it requires
Sounds like above my pay grade. I don't.
I know, I was gonna say, it's
Yeah, I'm not
it's
sure I'm,
definitely like
qualified.
professional plumber
Get into this.
thing, and it definitely, like I would say somebody from like Keating's would be able to do it. Like, I won't mention names of the plumber who wasn't able to do mine, but locally here in town, but it was something that I was like, oh, well, it's not horribly complicated, but I can see why you need a professional plumber to do it.
Well, I just want you to know from the nursing service standpoint, we very much appreciate him and what he's doing, and as well as the clinics. And also shout out to Becky Rhodes. She's been coming in twice a week because the clinics have been busier, and she's been doing that for a while and cleaning. So I just wanted to say she's doing a great job.
So come on out,
Takes a
DMV, health fairs, mobile market, stay tuned.
Yeah.
There you go.
Thank you guys for your
Thank you,
time.
guys.
Thank you very much.
Congratulations on the election. Like it.
Yeah. I'm honored to represent you.
Yeah, so you'll
We're
be-
ready to get back to work.
Do we wanna talk about our scheduling meeting with town while we have?
I would
Dana
defer
here,
to
or-
Gloria.
Gloria gave me 2 days.
Yeah.
Okay,
That they suggested, so hopefully one or the other will work.
I think
Okay.
between Will and Gloria, we'll get that.
We'll figure it out.
We'd love to get there.
thanks.
And you guys know where to find me, not wearing my public.
Yeah, I'm sure you
Thanks, guys.
Yeah,
Have a
thank
great
you.
day.
Yeah, thank you.
Thank you.
Bye.
Good morning.
Hey, Martha.
Should we wait for
How you
Dennis?
guys feel? Are you Chrissy?
Thanks. How are you?
Good.
Should I wait for Dennis or go ahead?
I think we can go ahead.
Okay.
Yeah.
Well, first thing will be the financials for February, which are pretty standard as our financials go. The payment to La Plata County was payment for some staff time, which is me and Emma, who does the finances, some child support, some child welfare. And then also the $2,000 for core services that we pay each year that goes towards the in-school therapy program. And then San Juan County, of course, is Chrissy's expenses. So then the second page of the transmittal is the calendar year budget. So of course, this is only through February. It looks terrible because we were $3,200 in the red. That's because property taxes haven't started coming in yet, really. So March, April, May, it'll bounce back the other direction. Just once we start getting those property taxes, otherwise nothing unusual there. And then the last page is the state fiscal year. which of course goes July through June. And the lines on there that are highlighted, the gray lines, are the ones that it looks like we've spent more than we should. So 3 of those we've talked about before, and I'll talk about more today with the childcare, the child welfare. And then actually Colorado Works isn't one of the grade ones, but it will be by the end of the year. So I'll talk about that in a minute. The core 80-20, you know, we always shuffle between the core 100% and the core 80-20, so we'll be fine with that because we'll just start billing it differently. And the LEAP, we just charged that to the wrong line. We have, as you can see, $20,000 in LEAP this year to spend on outreach and support. And we just, meaning LaPlata County, when we put the codes in, built the wrong code. So we'll just switch that. So the financials all look good as long as people pay their property taxes. Any questions?
Nope. Make a motion that we approve, transmitter number 2, for social services and not 9125.50.
I'll second it.
All in favor?
Aye.
Thank you. And then the second thing, which I only pulled together yesterday, so I did not send you up copies, but I made copies. If you want to look at this while I talk about it, I'll talk about it too. So this is the TANF funding that we talked about last month, as far as between Colorado Works and child welfare and child care. We will be overspent for the fiscal year 23-24. I just ran the numbers again yesterday, and we'll probably actually be overspent totally by about 18,000, but that doesn't take into account getting any mitigation from the state or any at closeout when they shuffle money around. So we won't actually be overspent by 18,000, and that 18,000 will come out of our TANF reserves. That 74,000 or 94,000 we have at the state. So last month we talked about transferring $10,000 in TANF funds from another county to San Juan County, so that we could help offset some of that over expenditure and keep our reserves buffer up. And Moffett County is able to do that transfer to us. And so what happens if you approve it is that San Juan County will get that additional $10,000 in TANF. It'll cost San Juan County $1,477, which is that maintenance of effort, the county share. But then we'll have that $10,000 to offset either this year or future years. And if for some reason we get a lot of mitigation this year, and we don't need that full 10,000 to offset, it'll go into the TANF reserves, because we can get the TANF reserves up to 100,000. So this will just help us buffer a little bit while we see what happens longer term with our San Juan County TANF caseload, because that's really been the big changes here. People are actually using that benefit, which is great, and they should, but it's just made a difference on the contracts and the reserves. So this letter, this is required by the Colorado Works Allocation Committee. The CWAC, as you say, or as we say, is mandated by statute. So there has to be a statewide committee that determines how Colorado Works funds are allocated. And so this letter is the format they require when a county is requesting to transfer money from or to another county. And so it's just addressed to Janet Rowland and Richard Elsner, who are commissioners. And just explaining that we're requesting to do the transfer and that San Juan County will be responsible for that maintenance of effort. I just need it signed by the.
You need a motion for that, really?
Yeah.
Do you want the motion to, I make a motion to send a letter to the Works Allocation Committee? How would you like that worded?
Yeah, just authorize Austin to sign the letter to the work allocation committee for $10,000 in TANF funds.
Okay, I'll make a motion to authorize Austin to sign the letter, okaying the transfer of 10,000 in TANF funds from Moffett to San Juan County, and that we do the corresponding maintenance of effort.
I'll second it.
All in favor?
Aye.
I always like that program, by the way. The fact that counties can help each
Yeah,
other
I
out.
think that's
Yeah,
great.
yeah, it's a no-brainer.
I just thought that was a neat thing.
Yeah, thank you. I appreciate that, and every once in a while, the state or the Works Allocation Committee looks at, should they change it and do close out the way the other programs work? And counties very much appreciate the ability to work together to use this in really creative ways. Actually, next week, maybe Wednesday, a week from today, we're having our, what's called management evaluation with Colorado Department of Human Services, which is an audit. They call it a nice fancy big name, but it's really an audit. Looking at our processes and programs, and it's specific to Colorado Works. And so they have already said they're really looking forward to hearing more about the contracts we have and the creative way we're working with our community. So that'll be fun to meet with them and share with them more about what we do. So those were my updates. Anything for me before I turn it over to Chrissy? Okay, it's all yours.
So I don't have a lot either. LEAP goes through the end of this month. That's the Low Income Energy Assistance Program. People qualify for that by income. So that goes through the end of the month. So if anybody wanted to apply for that, they have until April 30th to do that. The county apartments are still full and we still have a wait list. I added one person to the wait list last week. So we have 9 people on the wait list. I did go through and actually remove about 6 people from that list who are no longer here, who have found housing or who have passed away. So we got rid of a few, but we still have about 9. Our Energy Outreach Colorado program that we do. We have spent $7,180.50 so far this year. And we will receive another $1,250 in July, which will be the end of the grant. For a total of $12,500 for the total grant. So that's going pretty well. People are utilizing it, which is really nice. And then for the AAA shoveling program, as you guys know, we had a really mellow winter this year compared to last year. So we have about $5,600 remaining in the grant that we got. The grant was $10,968. So I spoke with Martha before and we decided that we could spend that with some yard work for those seniors that are on the program. And we have until the end of June to do that. So it's about 25 hours that Mario and his crew will have to do yard work for the seniors, which will be really great. But that's pretty much it. You guys have any questions for me?
No,
All right,
things are going good.
Yeah. Thank you.
yeah,
Well-oiled machine.
that's our goal. Do you need copies of these, Willie, the transmittal and the letter?
Oh,
I can get them. Probably. unless there's- Couldn't remember if you'd already gotten one else. Speaking of well-oiled machines, right? Yeah, absolutely. Thank you all. See you next month.
I enjoy that drive back. It's beautiful.
Yeah, the snow's not as pretty now, getting kind of dirty
It's
and
getting,
healthy, but
dirty look good.
that's okay. We have to have that before it turns green.
Thanks, guys.
You guys.
All right, we've got about 5 minutes. Is there anything we can really?
yeah, let's just go down to the correspondence.
Okay.
In your packet was, a flyer from, Echo Action Partners. They just requested that I get this to you and for you guys to fill out the survey.
Can you all hear me?
Yeah.
Sorry. You can? This is Spencer. Just want to check.
Hey, Spencer, we can hear you. We need to wait until 10 o'clock since it's a public hearing.
Perfect.
To the agenda, but yeah, we'll be with you in 5 minutes. I wish we could do it, but since we got to follow that protocol. Thanks.
No problem. Thanks.
So anyway, they requested that you fill out the survey, and at some point they are going to come in and present to the commissioners. That's what we do. Then also, in your packet, put in the Silverton business on it. The San Juan Development Association is putting together. And, then just the information from CDOT about the improvements over between Ridgeway and Montrose.
Say, are you safe?
No, not really.
I don't want to get anything.
So. On Red Mountain, do we have any major construction projects except for San Miguel's
I haven't heard.
project? Like, one thing, last year they installed those gas X, avalanche control devices up there, which is awesome, but I don't feel like CDOT really gave us a ton of notice that they were doing that.
They did.
Was just wondering if we were gonna have any more surprises this year that we know, and it's like one of those things, of course, we probably wouldn't know about them because they're surprises.
Yeah. It's pretty cool, but Blue Point was down a lot, and you can drive past and there it was down. That's a pretty interesting idea, so.
Yeah.
Yeah.
I think Blue Point is always one of the
It's the worst,
scariest to me to drive. It's
that's where my closest call has been, so Blue Point, so,
yeah, me too.
yep.
Although, man, have you guys seen any of the photos or driven over there recently with the rock fall and
I didn't see the big rock fall, but there's sure been a lot of rocks.
the ice too?
Yeah, that was big.
The ice
One
fall.
right past Engineer.
Yeah.
And those were the big icicles are on
Yeah.
the walls there. I was going the other lane. I'm not taking any chances.
Yeah,
They're huge.
I mean, I thought they'd done a lot of
Do they ever shoot
stabilization.
those down, Pete?
Have they ever shut them down? Not that I know.
I don't know. It seems like you could point the gun at them and blast them, but
You have to close the road and
yeah.
whatever, yeah. I don't know.
I've
I'm not
never
a,
heard if they.
I'm not a CDOT guy, so
Yeah.
I don't know that, but wouldn't be a bad idea.
Big lance in front of a loader. See if you could get far enough out there where it's not hazardous to you as you go down and knock them down.
You'd have to be really far away.
Yeah, I know, right?
Those things would kill you in a heartbeat.
Yeah.
Didn't one come down through somebody's passenger seat and something like that?
I think, one of them, it was actually, Paul Wilson, see, here I go again. Yeah, he's not with CDOT anymore, but it was Paul Wilson's car.
Is that right?
Yeah.
It's just
Personal
dropped
vehicle or-
Yeah, personal vehicle.
Went through his
Wow.
roof and hit the
Yeah.
passenger seat.
Yeah.
Ice,
No, icicle.
one of those big icicles.
Yeah,
Yeah, no, my brother, Jimmy, he was driving through there, a chunk of ice came through his windshield.
Yeah.
Really?
that stuff would definitely kill you.
Yeah, I always go the other lane, but then I always worry about a giant one dropping off, bouncing and then knocking me off the hill, because I'm in the other lane.
Yeah, yeah. I travel that all winter long and obviously with what was just said, I don't think I'll be doing that much longer at all.
Oh,
It doesn't bother me that much.
I bet not, I
Right.
bet not, having all that gold.
All right. 1 minute, I think we're okay unless you got something else we can do in 1 minute here. Yeah,
Yeah, we're fine.
I think we can move on. Hey, Spencer, can you hear us? And Adam, we're ready for you guys.
Yep, I can hear you.
All right. Welcome back, gentlemen. We're here to, today we're gonna open up the public hearing for, Adam and Spencer Rex, DBA Kendall Mountain House LLC improvement permit preliminary final plan for a single family dwelling and vacation rental commercial backcountry lodge on the forest load MS 18463. Willie, would you like to introduce us here?
Okay, so this is a public hearing, for an improvement permit, submitted by Adam and Spencer Rex, DBA, Campbell Mountain House LLC. It's a preliminary final, improvement permit application for the development of a 3,900 square foot single family dwelling and associated utility improvements on the forest load. Mineral survey is 18463. The property is located on Campbell Mountain and will be accessed by County Road 33. The applicant is also requesting the vacation rental / commercial use of the property be approved. The property would be used as a vacation rental during the summer months and as a commercial backcountry lodge during the winter. The applicant had previously received approval to construct a 2,000 square foot cabin on the site, but was denied the use of a vacation rental. The primary difference to the approved application was to increase the square footage of up to 3,900 square foot. Footprint would remain the same, but a loft would be included. Also included would be a covered porch. The request for vacation rental would be seasonal, summer only, and during the winter, guests would need to be accompanied by a qualified backcountry guide. The sketch plan was previously reviewed by the Planning Commission and received and recommended to the commissioners for approval. The county commissioners did approve the sketch plan with conditional approvals. The Planning Commission reviewed the preliminary final application, and they recommended conditional approval for both the single family dwelling and the vacation rental / commercial lodge. The applicant's preliminary final application has updated their seating quality report. They visited the site and installed 30-foot story poles at the corners of the proposed cabin. The story poles were not visible from US 550 and minimally from County Road 33. The applicant also submitted an extreme weather and avalanche risk protocol for Campbell Mountain House trips and San Juan Expedition Campbell Mountain House agreement for the use of the property. Copies of the risk protocol and San Juan Expedition were provided to Sheriff Bruce Conrad, Emergency Manager Jim Donovan, Ambulance Director Tyler George, Building Inspector David Harris, and County Attorney Janice Goldberg for their review of comments. Their comments were incorporated into the conditions of approval. The applicants revised their application to incorporate many of the recommended conditions. The commissioners have two separate items to consider. The first is an amendment to the improvement permit to allow the construction of a 3,900 square foot single family dwelling. The second is for the use of the property as a vacation rental / commercial backcountry lot. The commissioners have the option to approve as submitted, approve with conditions, or deny the application. Should the commissioners choose to recommend approval of the improvement permit to construct a single family dwelling on the forest load, they should do so with the following conditions agreed upon and are demonstrated prior to the issuance of the improvement permit. One, that the applicant acknowledge that emergency services will not be available in a timely manner and perhaps not at all. Two, all improvements to the forest load shall fully and completely comply with and strictly conform to all terms, conditions, and restrictions contained in the San Juan County zoning and land use regulations. All permits issued in all applicable state and federal rules and regulations. Three, that the applicant shall fully and completely comply with the San Juan County zoning and land use regulations 4-110, design and development standards for all improvement and use permits. Four, if any historic artifacts are discovered on site during the excavation or construction, all work on the project will be stopped immediately until the historic review committee or qualified archaeologist can visit the site to document and preserve those artifacts. The Great Fox Trail on County Road 33 be identified on the 35th survey site and signed in the Colorado license surveyor. Six, that the applicant be placed on the town sewage utility dwelling system, the refuse and the property continue with such changes. Seven, that the septic system be engineered and permitted. Eight, that the on-site water be tested for potability and measured for volume and determined suitable to provide adequate potable water for requested use. 9, that a Colorado licensed surveyor stake the property to identify the location of the cabin, porch, deck, parking, and other improvements. Storyboard shall be placed at the 4 corners of the cabin and the maximum height of the cabin. All trees that will be removed for the construction shall be identified. That the land use administrator or its representative visit the site when this has been completed. This is required to determine the impact the improvements may have on the scenic value of the site. Can provide a survey plan completed and signed by a Colorado licensed surveyor showing all improvements for the property. That would include the cabin site with porch and deck, driveway, on-site water, wastewater treatment system, or storage, etc. The vicinity map showing the survey boundaries of the property depicted on a 1 to 24,000 topographic map. 2 copies of all survey plans and etc. need to be provided in full-size 24 by 36-inch formats. The failure to comply with these conditions shall be grounds for revocation of this improvement permit. And number 12, any other conditions that the county commissioners deem necessary. Should the commissioners choose to recommend approval of the improvement permit to allow for a vacation rental on a commercial backcountry lodge, they should do so with the following conditions agreed upon and demonstrated prior to the improvement permit. 1, that the applicant acknowledge that emergency services will not be available in a timely manner. Perhaps not. 2, that the vacation rental be allowed only between May 1st and October 31st and is conditional upon wheeled access to the property. 3, that sufficient off-street parking be designated on the property and the parking County Road 33 be prohibited. 4, that commercial backcountry lodge use of the property be allowed from November 1st through April 30th shall only be allowed if the guests are accompanied by a qualified backcountry guide that has adequate experience in training and avalanche safety. The guide must accompany the guests from the town of Silverton to the site, stay with the guests at the site, supervise the guests, outdoor recreational activities during the stay, and accompany the guests back to the town of Silverton when they leave the site. That the applicant's Campbell Mountain House winter safety protocol include prohibiting access to the cabin or leaving the cabin during extreme winter weather or avalanche danger emergency evacuations, and they need adequate food, water, and heat for unexpected extended stays. The winter safety protocol shall include the following. A, the guide must accompany the guests from the town of Silverton to the site, stay with the guests at the site, supervise the guests' outdoors recreational activities during the stay, and accompany the guests back to the town of Silverton when they leave the site. B, to minimize the financial impact upon the decision making concerning the safety of the guest. There should be no extra charge incurred by the guest for extended stays, and guests shall receive a refund commensurate to the dates the backcountry lodge is not used due to a truncated or canceled trip. See that any changes in ownership of the property or change in guide service would cause a vacation rental guest housing for commercial backcountry use to be terminated immediately. A new application will then need to be submitted to the Board of County Commissioners for approval. Approval may be denied based upon factors such as safety record, lack of experience or inability, and or unwillingness to comply with terms as required by San Juan County. Applicable to extreme weather and avalanche trip protocol for Campbell House trips or non-compliance with other federal or state requirements. D, the applicant provides a maximum capacity, including the guide for stay at Campbell Mountain House. 6, the following shall be added to the San Juan Expedition Campbell Mountain House signed agreement. A, San Juan Expedition shall be responsible for the storage and parking of guest vehicles and said storage and parking will be in compliance with the town of Silverton snow removal regulations. B, the Campbell Mountain House provides proof of adequate insurance for the property. C, the qualifications and certifications of any additional guides not currently on the list of San Juan Expedition guides and their certifications shall be provided to Campbell Mountain House LLC and San Juan County prior to the use of the cabin. D, that an updated list of San Juan Expedition guides and certifications and proof of insurance shall be provided annually to Campbell Mountain House LLC in San Juan County no later than October 15th. That the applicant obtain a sales tax license for the Colorado Department of Revenue and collect sales tax and lodging taxes required. That the applicant submit a renewal application annually, providing the number of dates that the backcountry lodge was occupied for commercial purposes, together with proof of insurance to operate a vacation rental qualifications of the guys and proof of their insurance and licensing or permits as necessary. That the applicant fully completely understands and complies with these conditions. Failure to do so will result in revocation of the use of the property as a vacation rental commercial backcountry lodge. D10, that the applicant fully and completely understands that in addition to the applicability of the provisions of the San Juan County zoning and land use regulations, the county may deny renewal or revoke the permit based upon a failure to comply with any conditions or failure to adequately demonstrate the ability to comply in the future and or high levels of risk to the public based upon continued similar use. Together with any other relevant evidence of high levels of risk, the county may consider past incidents, expert opinions, and recommendations of emergency service personnel. 11, the applicant agrees to identify and hold harmless the county, its officers, administrators, employees, representatives, and emergency personnel for any claims and or damages related to the leasing, usage, and operation of vacation rental and commercial backcountry lodge. 12, any other conditions of the county commissioners may be necessary. And then I added a number 13 that I would recommend as an additional conditional approval that I didn't have before the planning commission. One is that both the winter safety protocol and backcountry lodge agreement documents be signed, notarized, and recorded. And B, that the backcountry lodge agreement should also include language that recognizes and agrees to the terms of the winter safety protocol. Should the commissioners choose to deny the vacation rental commercial use, they should do so for the following reasons. 1, off-street the parking spaces are not available at all times required by section 4-110. 2-1 through A. And 2, the proposed vacation rental is not safely accessible for guests and emergency responders as required by section 4-110.2 through B.
Are we required by law to read all that, Billy?
With that,
Are we required by law to read all that, or can we read that ourselves? All the stuff that you just read, are we required to do that?
well, because it's a public hearing, I think
Yes.
Yes,
It's a big thing.
okay, that makes
because
sense,
if we had a room full of people here, you want to give them this information.
I got you,
It gets trickier with the online stuff.
Yeah.
It really does. It used to be you just keep a copy in the office and anyone that was at the meeting could look at
could
it.
look at it or look at it prior or something like that, so. Okay,
It's good practice.
okay, just making sure. Cause that was a long one.
That was a lot.
But, yeah, but can, you know.
Yeah.
Just add everything in there, yeah.
Yeah.
All right, Spencer, Adam, if you guys want to add anything for your application to what Willie introduced or tell us anything else, please go ahead and speak now.
Hey, I just a quick question. I just saw this yesterday. With the sewage disposal, adequate sewage disposal can be provided to support the proposed use. The applicant has previously submitted to San Juan Basin Health, and now we need to do it to La Plata County Health. So we submitted to San Juan Basin Health last year because we didn't, and you know, it was a big fee, and we didn't want to have to go through it again with La Plata County. So I'm just wondering, I guess why is that requirement there, and is it really necessary?
That's an easy one because the other one doesn't exist anymore.
Right.
San Juan Basin is no longer in existence. It's been taken over by La Plata County.
If your system has been installed and inspected and signed off by Basin Health, then it would be fine, but basically because they're no longer in business to do that, then you gotta go back and do it through La Plata County.
All right, I just wasn't aware of that. So I guess overall I would just say I think I've done the best that I can to you know, put everything in this application that the county wants to make this thing absolutely as safe as possible. and, as far as the backcountry views. And I think where we've ended up is, a really good place, really safe. Um, you know, for this thing to be commercially viable, we're going to have some very high-end clientele, the kind of people that are going to tip their Silverton guides a lot of money. And I think it's going to be a really good thing for the community. And yeah, I'm just excited to do it, and I hope you guys approve.
All right, thanks, Spencer. Should we open it up for public comment at this point? Yeah. If there's anyone from the public who would like to comment on this application, either on the building plan for the single family dwelling or the vacation rental, please do so now. Hearing none, we will close the public comment and open it up to commissioner discussion. You have somebody?
I have
Go ahead, Scott.
questions, what did EMS and OEM say in their letters? Did they have any problem with it? I don't have that information.
Yeah, it was actually my staff.
Yeah, it was,
Was it?
yeah, you said it.
Certification.
Okay, I missed it.
Yeah.
I missed it, sorry.
No problem. Basically, Bruce said that he had no problems.
Bruce isn't a major backcountry skier, he's a snow.
But he's basically, his comment was that, he's familiar with their people and they're good actors.
Okay,
So he had no problems. Jim, actually Dennis had most comments, and we managed to incorporate those into the agreement. And Jim,
I still don't see it.
okay, well, Jim, stated that the guys need to stay at the lodge to be added to the operating plan, which was done.
Right.
He pointed out that San Juan Expeditions would not be able to transfer their permit to another entity, their BLM permit. So, it would just be the San Juan Expedition. We wouldn't have to worry about the other. And this thing was just emphasizing that EMS is and search and rescue services maybe to be limited in the event of an extreme weather avalanche risk if the group is already at the facility, which we cover. And Tyler didn't have any comments. He didn't respond to them.
Okay. All I can say is that I appreciate the work that you guys have done to provide safety for your guests, but to me, there's still too much left to chance, and that's just Mother Nature. The 5 people that were killed on Overpass, that were guests at the Opus Hut were all skilled experts in their fields. And it didn't matter. They made a couple mistakes or were complacent and were killed because of that. Even though, and I'm going to give San Juan Expeditions lots of credit. They have some very highly skilled people. We have at least one incident I can think of where a guide service was provided and a client was killed, and there have been rumors, and I'm just saying rumors of actual guides in this area being caught in avalanches this year and last year. Even if you're an expert, it still doesn't mean that these avalanches can't happen. I always considered my future son-in-law to be an expert. He's taken all the avalanche classes. He was with search and rescue here. And I still remember on the Rio Grande where they went to ski it. They were heading up there, and that slide had ran before they got there, maybe that night. But they had looked at everything, CAIC, dug their pits, everything, and that slide had still run. And they were planning on skiing that, so, I think we're setting ourselves up, for the chance of a really, really terrible accident, even though experts are involved. I appreciate the fact that you enlisted these guys to do that, but I still think, we're setting ourselves up for a disaster.
And I think we should examine these again separately based on
Okay.
the permit and the
Okay.
vacation rental.
Well,
Application.
When we go to
if
that
that's okay.
one, I've said no comments.
Yeah.
I don't have any problem with the, first proposal.
Sure. Yeah, I had just our discussion based on the planning commission review. We discussed a lot of the avalanche mitigation efforts on there. The one thing that wasn't included in there that was Jim's comment as well, that there was nothing in the actual agreement that the guides stay overnight, which they have fixed
They've
in this
done,
application. They've done
Yep.
that now. So thank you guys for doing that. While I appreciate your comments, Scott, and I understand there's absolutely nothing we can do to say 100% we can
Right,
guarantee the safety of
anybody.
anybody in the backcountry. I also don't feel that it's our responsibility as county commissioners to prevent every and all accidents that can happen in the backcountry.
But it is our responsibility because we're responsible, for the health and public safety. So it is our responsibility.
Oh, we could be doing a lot more than for that if we're,
Well,
if we're doing that,
but this is, this, as far as people just going in the backcountry, I don't, we're not really responsible for that, but this is a service being provided where people are gonna be going there, could be once a week and exposing themselves to that where, as far as what's going on top of Red or people skiing this stuff, I don't, that's your choice to do that.
yeah, I think I could point to a number of incidents that I think are and potential hazards that we have. Our local ski hill here, right above the Black Run, I can see right in the window here, the slide path that comes right down into it, and there's another one
I've
right
seen
above the lift.
Yeah.
I've seen children trigger avalanches, one this year, on right above the chairlift.
I shoot kids out for climbing on that and had parents get on me and
Yeah.
because your kids were in an avalanche.
Yeah.
So.
Yeah.
Yeah.
I watched two kids bury themselves up over their knees, and it wasn't even that much snow there
Sure.
compared to the last time I saw it happen.
That's more of a town issue though,
I mean,
in a way, that as far as, avalanche awareness, closing areas off that shouldn't be open.
Sure, but their permit, exists in the BLM, and surrounded by BLM, that's county land. We've had cross-country skiers almost be caught in slides on county roads that are groomed and maintained by the Colorado Snowmobile Association.
State highways,
Yeah, state highways, yeah, we've had, there's all kinds of examples that we can get, but I feel a lot better about this application than I do some of the other backcountry lodges that don't require that.
I agree.
And I think,
Because we have no say of what's happening on Opus, even in like that one incident with a bad storm. We still went because they felt obligated to get there because they had booked it for a week and they tried to get there during the storm and almost, at least one of them almost lost his life over it. I'm amazed he kept his fingers and toes.
I've been terrified breaking trail up there for search and rescue and personally
And as
going
you guys-
up there to go up to that lodge.
As you guys did on the Opus Pass extrication.
Yeah.
You guys had slides run behind you on that Tuesday, if I remember. And that's because we went from freezing weather to 50-degree weather, which is, that is I can think of at least two people where that's claimed people's lives because they didn't take into effect the fact that it was a warm day.
And, I know it's not foolproof that, that Rio Grande slide can happen and whatnot, but this is an area too that is a maintained trail too in the wintertime. And it provides our emergency services a lot better access than Opus does. Cause
I know,
Opus,
of course.
if we ever have a chance to talk to, I think it's Dave, who's the new owner up there. We should probably ask him to maintain a snowmobile track in there so that
Or snow.
emergency services
Yeah, I think that's,
personnel
I think that's a good idea.
could actually access up there, because that was pretty scary to
No, that's.
go across that and not have anybody come up after me and
Yep.
if something had happened to me going up there, I don't know how quickly anybody could have responded to me, so. Yeah, I
So
just,
you're feeling more confident just because, and it makes sense. I mean, there is an expert guiding them up there and in fact, staying with them. I mean, that makes a lot more sense too.
And with those guides, they're leaving it, I mean, I can't tell you how many times I'm plowing, whether it's Burrow Bridge or whatever. And you're seeing people leave at 2 or 3 in the afternoon, because they're not guided, I mean, just blows my mind,
yeah,
right, in the spring.
Yeah, I just
And that, with this, that won't happen with this at all, because San Juan guys are going to be with them the entire time and give them some tutelage.
Yeah, I saw that on Chattanooga Easter Sunday, I think
Yeah,
it
I
was,
mean-
guys coming down the steep stuff on
Yeah.
Chattanooga, and it was 4 o'clock.
Exactly.
yeah.
And it was a 50-degree day.
Yeah, I agree with Pete that just with a guide, I don't think that those kind of glaring mistakes,
They won't allow
I'd make the case that the 5 fatalities that we had on overpass, if they'd been with a guide, would not have happened.
I think, you did mention, Scott, that, you've heard rumors about guides and stuff, and I mean, historically, there's been people who know better that gets caught in slides. I mean, that's usually the ones that get caught are the experts, but I think there's a difference between a guide doing it because they're out recreating as opposed to a guide that's responsible for
They're gonna be more cautious.
10 people.
Yeah.
The accidents that I've heard of our forecasters, a lot of, even some of them on the road, if they had somebody else who was not experienced with them, that's a different scenario, in a guide client relationship versus personally recreating, for sure. Yeah.
Okay.
Do you guys have any other comments? I know we've discussed this.
I like number 11, and I think you came up with this.
You guys had mentioned that.
Yeah, I mean, the number 11 is, the indemnification and, go ahead. Yeah, I think that's,
The only thing, the
I haven't seen that before in a lot of them, and that's key.
only thing I would add to that, Billy, is, it said officers, which is sort of an old school way of describing, commissioners and all that. I would say officers, commissioners, I would add the word commissioners in there as well. And that would cover, planning commission as well as.
Yeah, that's
Technically,
I haven't
not
seen
smart, but, it's.
language
feel good,
before, it's
yeah.
good.
Yeah,
Good language.
just to be clear.
Um,
And then there is. We did add in terms of, there's a renewal each year,
yeah,
and then
Absolutely.
if there is problems, if there is, serious danger issues that are rearing their head on a regular basis, then you guys can consider.
I think that's very important too,
Curiosity.
right, year to year.
Yep.
Because
I just have a
something-
report on.
Yeah.
all right, well, I think if we don't have any other discussion, I think I guess I'd entertain a motion for the approval of the preliminary final plan for the single family dwelling on the force load MS 18463. It's just for the construction.
I make that motion.
I'll second that.
All right, all in favor?
I,
And our next, I'd entertain a motion for the approval of the vacation rental on the force load MS 18463.
Subject
subject to all the staff conditions and with the addition of, on condition 11 of commissioners added into that language.
And your first motion was also.
Your first mission also filled with conditions.
Yeah.
Sorry,
That's a mouthful.
yeah.
It works.
Um,
I'm gonna make that one, Scott.
Go ahead.
Okay, well, not sure if I can include all that. but-
I have to say so moved.
Yeah, so, okay, so move, yeah, there you go.
I'll second that, Scott, if you don't have to. All in favor? All opposed?
Can we, was that an opposed?
Yeah.
I'm opposed on the basis of, the one part that said.
On the vacation rental?
Yes, let me find it.
So to be clear, you're not opposed on the construction, you're opposed on the vacation.
I'm opposed on the vacation rental due to what I think is a dangerous situation. And that was it, that was in your, I can't find what I did with it now. Here it is. I had it circled.
I just want to make sure the record is clear.
Sure.
That he
Yeah.
wasn't opposed to the.
Yeah.
Part.
First one, but
You
the
have
second one.
to, you have to give a reason, and my reason was the proposed vacation rental was not safely accessible for guests, emergency responders as required by section 4-110.21. So that's why.
Okay, Adam, Spencer, do you guys have any questions for us?
Did we do it? We did, we're done with that, right?
Yes,
Okay.
yes.
So,
They understand it's approved. They understand it, but
Yeah,
So summer use and winter use are approved
yeah.
Correct.
as,
but,
as stated with the conditions. Okay.
Yes, yeah,
but it's a yearly renewal.
For the
Yearly
vacation,
renewal.
for the vacation
Part of it, correct, Scott?
Yeah.
not for the building.
Not for the building.
Understood. And yearly paperwork from San Juan Expeditions as well. I'll let them know.
So,
Correct.
so what'll happen, Spencer is I'll put together a letter spelling out everything that still needs to be done, how it needs to be done. Those type of things, but yeah, it's essentially what, it's approved with the conditions as outlined in the staff.
Very good. Thank you.
Well, this is just a question of protocol, even though San Juan Basin Health, they went through San Juan Basin Health. Will some of that at least be able to transfer to La Plata County, or do they have to start completely over?
I think they're continuing my application.
Yeah, I mean, I think.
Okay,
I think
so that they don't have to, what about like a fee structure? They already paid a fee. Do they still have to pay a fee to La Plata County?
Yeah.
Okay,
But I think we got reimbursed. The county got a check for the applications that weren't approved. So,
that could carry over.
yeah.
Okay,
And actually,
I think we're still figuring.
the same guys are
Yeah.
working for a lot of guys, so Brian Devine, am I correct on this?
Yeah,
It's
is
still,
that,
yeah,
is that right?
yeah, so they're still there, so
we're still kind of figuring out.
we're kind of dealing with the same group.
I'm assuming it's gonna be streamlined because it was already started, but I'm assuming that. I shouldn't assume, but everything else seems to be going that direction.
Okay.
So, as I said, my daughter went down for the vaccine thing, and that used to be San Juan Basin Public Health. It's the same building, everybody's the same, all the programs are the same, the sign's
And
different.
the same player.
Is that right?
The sign's
Different output, yeah.
I feel for you guys, for having to be kind of the guinea pigs in probably the first approved permit, that had a ongoing septic with San Juan Basin Health. If you're having problems or struggling, with that process with them, please, we'd really like to know about it. and, we have some recourse, I guess, through the commissioners to put pressure on that group, but I hope that, just as Dennis said, it's the same players, the same people who approved your permit at San Juan Basin Health are working now for La Plata Health, and so I'm hoping this is political differences that don't affect your project.
I'm confident it's gonna go, it's gonna be. fine.
Yeah.
It's gonna be
I think the key is if you get yourself a reputable engineer, everything's gonna go smoothly.
Which they've got the like
Yeah,
Nashwood on there, so I think you'll be okay.
that's a home run usually.
Yeah, all right, and anything else, guys?
Dudley Ashwood, yeah.
Okay.
No,
Thank
not
you.
for me. Thank you very much.
All right, thank you, as Willie's wife likes to say, good luck, go forth and prosper.
There you go.
Alrighty.
All right, next we have Lisa Merrill and Melissa Schmeens and Megan Master from BLM.
It's Melissa Smiles.
Sorry,
No problem.
sorry, Melissa.
I got a clear name.
That's all right. I always think Smeen sounds like maybe it's my alter ego, right? Like which one's coming today? We'll see.
Yeah.
I have a PowerPoint presentation to share. Just can I? Oh yeah, I have the share screen option here.
I believe so. We don't have a whole lot.
You should be able to just share.
Okay. All right. There we go. Can you see the?
Yep.
Yeah.
Great.
Watch this.
All right. So thanks for having us this morning. I'm really sorry I can't be there in person. I had a late night public meeting in Fairplay last night, so wasn't able to make it to Silverton. So I appreciate that you guys are still offering these Zoom options for us. But thank goodness Lisa's always up there in person. So we're going to run through our proposed plans for FY 2024, the field season. I think when we start getting into it, you've seen a few of these. We thought we might have gotten to in the FY 2023 field season. So hopefully a couple of these projects look familiar to you. And I bet the same thing will happen again this year where, we have a pretty ambitious list of, long list of work to get done this year, but we may not get to everything. So I think that's a recurring theme here for us. So FY 2024 work plan, and then if you guys have questions through any of this, just holler. And Lisa, I know you'll have stuff to add too. So
A little print out of like that list.
Yeah, that would be wonderful.
Yep.
I'd love to have a print out just of that. I don't need.
Oh, you want to print it out?
Yo, that'd be great.
Oh, sure.
Yeah.
Yeah.
Yeah, we can do that.
That's a long list.
Yeah.
it is. That's why I'm preloading with, I don't think we're going to get to all of this, but some of these items are work items that we kind of started last year too. So, all right. So we're going to continue working on the LARC. We did a lot of work on the geophysics last year, more work than we anticipated. And then towards the end of the season, we thought we'd be ready for a drill rig to install a borehole so that we could control pressure in the adit while we were adding pipeline for access for O&M into the adit. Our goal isn't really to get into the adit, like to get in there and clean it out. Our goal is to change out the existing drain pipe to something that is easier for us to perform O&M on. Right now, there's pipe that runs under the mine waste pile, and we can't really access that. And we can see that it's filling up, and we are not able to clean it all the way back to where we'd like to. So the goal of the work at the Lark is basically just to make O&M easier for the long term for us. And then we will be putting making the surface of that the repository that's at the site. We're going to be putting in some positive drainage up there, and then also so this year we intend to get in there and be able to drill. We did get a drill rig scheduled or available for June, I think is what it is. We don't have exact dates yet or anything. And we will, of course, be, we've been working with the EPA on the fluid hazard analysis, just as a second opinion on ensuring that we're not going to, cause any trouble with any unanticipated, we'll be ready for any kind of unanticipated flow, So I guess it's not unanticipated if we're anticipating it, right? But
is there a settling pond there in case you do have something unanticipated? Is there a settling pond there already?
Yeah, well, not yet. We will be installing that in the cap of the existing repository, that flat area. We plan to put a lined pond in that area. We'll have, we'll be ready to flock any orange water that comes out of the adit and then pump it into the adjacent, that avalanche kind of run located to the east. I don't know if we have a figure here I don't think we did put in a figure for the Lark, but
There is a map there, but it's distant.
oh, okay. So but yeah, we do have plans to deal with water. That's, even though, we really haven't got any evidence suggesting we're going to see much water, but we definitely are planning for water.
Are you pulling up the drill rig and drilling horizontally high in the adit, or are you gonna have to build a road up above, and how far back are you gonna go if you build a road?
There's an existing access into the area up above the adit. So
you won't be tearing up a bunch of tundra putting in a road to do the drilling?
no,
It's almost
it's
like
existing.
they would have planned for it.
Yeah, okay. All right, we've got the Forest Queen on here. We did just get the so we've been talking to you guys about the Forest Queen for years. We're in there, I feel like we're in there every year. And one of the things we've been noticing, so last year, we did that work to improve it's the drainage of the Forest Queen adit water across the county road to our Iron Terrace. While we were doing that work, our contractors just noticed a lot of flowing water in the area. Is it to the east side of the road there before it flows across County Road? There's a lot of water building up in around the Forest Queen adit. So we want to drain that. And so we don't want to open the adit. I think that actually the closed adit is providing some benefit, keeping oxygen out of the system for a little bit longer until it gets over, to our Iron Terrace. We are proposing we will drill. I think it's I have some diagrams that I can share, but we're proposing to drain that adit. And this year we will be doing work geophysical work to understand where the adit is located. And we want to as well here, we want to make sure that That slope is really steep by the Forest Queen adit, and where that, manhole cover is. And with the continual buildup of water and flowing water, we don't want that all to become eroded out. So what our intent is to, just dry that all out, and then improve the piping that's going through. There's a concrete wall at the adit of the Forest Queen. We want to improve that and then, have access, long-term access for maintenance there. So I think we have some slides here that we get into that a little bit more. But that one, I think if the Forest Queen was in a different location, not next to a new growing subdivision, we might not have as much attention on it, but that location close to, new homes going in and,
It's
pretty
not,
easy
it's
to
not
access.
it's not close to them anymore because they got to move across the road.
Right.
Because,
Correct.
I'm gonna zip it on my comments on that. but,
We,
Are you planning on trying to put a road on that steep slope to drill out the adit, or are you gonna just? I mean, why don't you just dig the thing out, expose the adit and just let the water run across the road? It has no hazard, it has no health hazards. They're not super high levels of metals or anything like that. It all seems so pointless to me.
yeah, we have actually really seriously considered that, and thought maybe keeping it buried and just improving the access or the piping and keeping the flow coming through that adit, but keeping it buried might actually provide benefits. Keeping the iron from to the location where we currently have it building up versus in the adit area before it crosses the road. So but
The
those are all,
the iron's gonna build up no matter what you do, really. I mean, even if you got iron building up and it's supposedly a non-oxidizing environment already. You have just iron in the water. So whether you open the portal or not open the portal, you're still gonna have iron, I think.
yeah. No, I think you have really great, those are great recommendations, and certainly there are things that are, we're considering for sure. But first, the location of the drill hole will not be right in that footprint. It'll be, I get my directions. I think it's to the south. And we'll be working like from the existing road. So, not right in that footprint where the existing adit and the manhole and everything is, just off a little bit, so that it's a little bit safer. And then, of course, like that, the drilling work will require a road closure while they're working in that area. So we're sensitive to timing on that as well. I know that there are certain times of the year when having that road access is really important for the county. So
Excuse me, are you talking about the additional access road or the main county road?
the access road, not the main county
Okay.
road.
Because
Yeah.
they do, we've seen flooding and rain and everything else where you do need that road. So, if you guys can kind of be mindful of that.
Yeah. We'll keep an open communication on that when we anticipate this project starting. And when we anticipate the road closure needs. I don't have a schedule for it just yet, so I can get that to you guys. Okay. I'll move on. I think there may be slides down the road too on the Forest Queen if we have additional discussion or questions. The Mineral Point ditch, we did make that acquisition in December. I think that hopefully we reported out to this group. I know we've seen, okay, good. Good. Thanks for shaking your head there.
Well, that's exciting.
Yeah.
Yeah.
I think that's awesome. We appreciate you guys did that.
That's a great. So this year we want to move forward with the restoration of that ditch. Currently, like we did at the end of the season last year, late September, we were able to divert the water back into the Upper Animas watershed. But the ditch, the structure of that ditch still remains. And so this year we want to focus on restoring. So you can see the material that was taken out of the ditch right next to it. Our plan is to just backfill the ditch, and then we're working with MSI to do some revegetation work. So that'll be a long-term revegetation work with the MSI group. But for this summer, it'll be more the heavy equipment element of that, moving the material back into the ditch. Some of that
Are you gonna pull all that material back to the ditch and then back to the mine dump? Are you gonna pull all that back to just one big pile, or what are you gonna do? Because the ditch is essentially right through the middle of the lower part of the mine dump. Are you just gonna pull all that waste material back to the original dump, maybe?
Essentially, we're going to put in we're going to bolster that point where the Burrows Creek comes out and hits that Boston mine site. We'll put in a structure there to make sure that water doesn't, continue through the Boston. It'll be pushing water and directing water into the Upper Animas. And then, we would be consolidating that material back, pulling the rest of it in onto the Boston. Yeah. And we're working with so that one is an interesting project for us because the Boston mine site is on private land, but the BLM has an interest in doing that ditch reclamation because of our interest in the water right. So we are working with the EPA so that BLM can do the work in that footprint of the Boston mine site. So that's an interesting project. Pretty simple, straightforward, but we can make it complicated with paperwork, right? That's the Red Cloud work. We had some safety closures planned. We were replacing, there's a couple of big concrete panels on safety closures up there that we were trying to get done at the end of last season. We were not able to, so we're gonna pull that into our work for this year, and there's a lot of erosion control. That's one of the NPL listed sites, and basically the project will be a focus on erosion control because the Red Cloud mine waste rock is, you can see it stretching down the hill up there. So a Burrows Gulch also, this is all in that same footprint, and I know I have a map up here in a second. That fen restoration work, which is just downstream of the Boston and the Red Cloud. We are working with MSI and to do some restoration work. And I think that'll happen this July, actually. The Vermilion Tunnel project, we do have some maps for this. This is a hotspot removal, but we will be using the county road. So we do have some traffic plans to share with you guys and hopefully get your input and approval for that. I missed that if you had a question.
I was just asking Lisa, that's the lower tunnel, not the one up in the basin.
That's right.
Yeah.
We are doing a study in the American Tunnel right now. The BLM owns like the last 200 feet of that tunnel, just beyond the bulkhead, the last bulkhead there. And we are doing a study right now to understand. This is just using existing data. There's not going to be any work or anything, but we want to understand if there's a way that we can reduce the flow of water into the tunnel. Right now, the American Tunnel flows at like 80 gallons per minute. And if there's something that we can do to reduce that flow, we want to understand. And then, of course, we're trying to understand the cost. There's a cost benefit analysis as well, like how much could we potentially reduce flow by? And then if it's, not a crazy amount of money, that kind of discussion is what we're technically feasible and then financially responsible.
What's your metal loading coming out of the American Tunnel?
Oh, I don't have those numbers right off the top of
Well,
my head.
just give me an estimate. I mean, is there,
It's gonna be top 6 loaders.
so, okay.
Yeah, so it's one of the ones being considered for, the long-term water treatment plant, that conversation. American Tunnel is part of that conversation.
I guess it's just interesting that the water is so polluted coming out of there, even though there's multiple bulkheads. But, well, where's it coming from then?
Yeah.
I mean, yeah, I mean, if you have the data showing there's metals, coming out, you have to deal with that, but it's like with multiple bulkheads, why is there still so much polluted water coming out? So,
Yeah, well, and so much of that water is coming out the first 300 feet.
it's just coming out of all okay.
You'll have to go in sometimes, huh?
Yeah, it's been a while since I've been in there.
The Mammoth Pond, we've been talking about that with EPA for a couple of years. I think we've brought it up here. Basically, there's a trespass pond at the Mammoth mine site that was put on BLM land. And we're gonna, this is the year, we're gonna get it out of there. And Kirsten's gonna do that work with DRMS, is gonna do that work for us. And basically, we will restore that. We'll treat the red sludge in place, get it to a neutral pH, and then recontour that hillside so that it's not draining into the EPA's newly expanded pond in the footprint there. So that'll get done this year.
Taxpayer paying for that, or is the mine owner who did it?
I don't know. So another project that we have going on this year. Did you
Hannah's, right, Melissa?
No.
Yeah.
Or Davey? I wouldn't say anymore.
The Mammoth mine is?
Well, that was his claim adjacent, but.
Oh, okay.
Yeah.
Oh, I don't think I realized that. Oh, okay.
Smack us, guys.
Yeah.
I didn't say
You waited right till, till that.
Okay, moving on. Sorry. The Alpine Loop campground, we're evaluating the campgrounds along the Alpine Loop, basically for to understand if there's soils with high lead concentration in these campsites. So this is part of the BLM's we have gone out and done a lot of campground designation work over the past year, and we were not able to evaluate those sites before we had the, before all the decision documents were signed. So we're going in now to make sure that the sites are, safe for people to be camping in. And so we've gone through and we've taken our recreation folks have given us information about which sites that they have designated as dispersed campsites. And then of those campsites, we have done like a desktop analysis to try to understand which sites may or may not, we need to be considering if there's lead, high lead concentrations in the soils. So that'll be mostly sampling this year. Hopefully.
That doesn't include road closures, right?
No
road closures on that, okay.
No, because it'll just be a sampling effort this year. And if we have any proposals for cleanup, that'll be a whole different endeavor. So, or closure, or we're not, you know, whatever that might be. The Cunningham Gulch Beaver Dam analogs. Lisa spent a ton of time this winter on the Army Corps of Engineer permitting. So I think, is that work gonna start this year, get going this year?
Right now, it looks good.
Tell us what you're gonna do.
I might, if you don't mind, I might wait till we get
Okay,
to
how's
that
that?
slide. We actually have
Sure.
slides for each of
Oh,
them.
I
good,
know,
yeah,
we forget.
okay.
Animus Forks, we have slides for this one too, for discussion for, and then I'll skip these conversations I'll wait for the slides. I always forget that we have slides. Sorry, Lisa.
That's all right.
San Juan Chief, Roy Prey and Palmetto projects are not in, the Bonita Peak area, but the San Juan Chief, that one is in San Juan County. And then we have some safety closure projects as well. So, all right. I'll skip this slide is, you know, our time frame for getting, action decision documents, out. I don't know if this is something that's of interest to you guys, but typically you'll see our notice that the BLM's taking a time critical removal action, and that's what most of these are, the action memos for that kind of work.
Melissa, may I add here, some of you might want to see an action memo too at some point. We're required to put a paper copy in the library, whatever interests you.
Where you just drop it off at the shop.
Right.
I am very concerned about what you guys can do at Animus Forks. Instead of digging up the soils, I think it would be better just, if you're that worried about it, just fence it off. You know, just rolling an archaeological site, because all where you're talking about, where the mill is, the town site through there, where I think I mean, there's foundations and all that. I did.
We do have a slide, right, Lisa? We do want to talk to you more about that. And our goal is to find a workable solution there for everybody. And maybe that is fencing, but we'll see. I don't know that we're hoping to get work done there this year, but I'm not sure.
I mean,
So
that's one of our most, and I understand where you're coming from on the left, but it is one of our most visible and visited sites in San Juan County, so that's why it has to be protected as is.
Right.
I mean, it has to be.
Yeah.
right. Well, and that's what we're hoping is there's something that'll work for everybody, right? To keep people safe. And of course, like we're obligated by law to not disturb the archaeology there. So that's what our goal is.
We have been told that it looks like a special process that we need to follow at Animus Forks for getting your input and getting the Historical Society's input. So Melissa and I sure intended to, engage you more right now. But because the process kind of has this set way that it has to go.
So slow, yeah, we were gonna look at it last year. I think.
Right.
Yeah.
Yeah.
We even talked about a field trip, remember?
Yep,
Yeah.
yeah, and we still definitely, we know we need to do that with you guys, with the Historical Society, but we have to follow the process that the archaeologist has laid out.
Yeah. And so, yeah, so, well, we do have a slide. Let's put, put that. We put all these slides together. So cultural, we are required basically because all of these sites that we're working on are eligible for the historic register. So we are required to have an archaeological monitor present on site. And so we kind of set up these rules with our archaeologists that we're not gonna go here or there. We're just gonna do work here. And they require us to have someone on site to make sure that that's what we do.
That's a
And
good
then,
idea.
And yeah, and then I think it's good actually if you do, because we're digging around out there. If you do run across anything, you've got immediate response on it. You don't have to stop and go find your archaeologist and all of that. So I think it's been working.
It's a huge expense, a big addition to the cost of the contract. To have that monitor on site, but it's great for both sides, the contractor and the BLM, because it kind of keeps you all in check.
Especially if you come across something you didn't know was there.
Yeah. Yep. Okay. This was our LARC repository O&M project. This is the location. If you guys don't have questions or anything about it, I'll just move on to the next slide here.
I just had one question, that building there, that's kind of almost about to fall into the county road, or not the county road. Yeah.
Right.
Did you guys ever have a chance to go look at that building and whatnot? I think it is on BLM land, but.
I think we determined it was not, right, Melissa? The one with great equipment inside?
Oh, yeah, that one is not on BLM land, by the Joe and John, the one by the Joe and John there.
Yeah.
No, I don't think it is. That is a pretty interesting building. I'd love to do something with it, but it's, yeah. It is kind of cool to get in there and, peek through the cracks in the
If
see what's in
it's
there.
not on BLM land, do you guys know whose land it's on? Because I'm looking at the GIS right now and there's no property
No name on it.
record on there. I mean, it sort of shows it as BLM.
Does it?
We'll have to look at our cadastral again, Melissa.
Yeah.
Just curious.
No, I'm glad you brought it up.
Yeah.
Because it'd be nice to see it restored.
The
If it was on
equipment
BLM.
is protecting.
Yeah.
Okay. We do that every time we go by there too. Is that on BLM? We look at it, take some pictures.
Yeah, it's our GIS is not infallible for sure, so there's a good chance that, whatever property record it is, it's just not online, but yeah.
We do have really good lines for that site, so
Yeah.
we at least should be able to determine it really well.
Yeah, I mean, even if we can figure out whose it is, then maybe we can get permission and some grant funding or something to restore it or protect that equipment.
Yeah.
Pretty sure we said this last spring, like
We
almost
do.
this identical conversation.
Yeah.
We do, then we get busy.
Yeah.
Good ideas though, good ideas.
Actually split core for Chevron in one of those buildings about 40 years ago.
Oh, one of these buildings are there, I think.
I think one of the back building, that bunch of core in it, probably.
Yeah.
I split a bunch of that core. They were drilling on Red Mountain number 3, I guess. So, yeah. Still full of core over there.
Yeah.
Very cool. Okay, this is our map outlining the work areas that we have up at the Burroughs Gulch, up in Burroughs Gulch area by the Red Cloud. So here we'll focus on erosion control around this pile and in the road here. We will have road closures probably required during work on this road, but there's not a lot of traffic on that road.
Are you guys just gonna bring heavy equipment from the road up the dumps so you're not going out on the tundra or anything like that?
Yeah, there's enough disturbed area right next to the road. We should be able to
Are there-
just track on the.
And are you replacing the concrete slabs that were already put over the shafts, or are there more shafts that you never got covered?
No, we're just replacing.
Are they starting to tilt into the ground and stuff, or
Well, they don't, DRMS, you probably know Melissa more about that era of DRMS closure. But it's more that we're gonna try to keep water out and improve drainage at the site.
and if you can keep the water away from the shafts, it might not come out the bag.
Yeah. But really, the road is the worst culprit here for
Sure.
migration of metals.
You guys
Yep.
know that the Bagley Tunnel goes all the way underneath all that stuff.
Briscoe Bagley?
Briscoe Bagley
Really?
comes underneath all that.
That's
That was
interesting.
the goal, yeah.
Yeah.
Is that
Um,
big piece of equipment still there, the big double hoist drum?
Mhm.
It is still there,
Yeah.
my goodness, that's a
Yeah.
big piece of equipment.
Yeah. This might be a place too, or the next slide, I think actually, is a good one to talk about that. We still have not gotten 0.25 of that 11, what's the measurement? Blanking.
11 CFS. Yeah.
11, the ditch is 11 CFS total, 0.25 was sold to a guy in Uray. And years ago, in the 90s, during the whole, all the ditch happenings, and because of some technicalities, the Department of Justice has had issue getting that 0.25 because of how the guy in Uray, his name is Hinkson, how the records went with that 0.25, and there's nothing dark and dirty about it or anything. It just wasn't done in a process that Department of Justice recognizes. So we're having to go through a quiet title action on that, and that's taking a lot of time.
But it's not like the guy can hold out for
No.
millions for his 0.25.
No, and he's been very,
Okay, okay,
he's been great to work with, and that part of things hasn't been a problem.
thank goodness,
Yeah, it's more the process that we haven't been able to
Okay.
get through.
just get a quiet title.
Yeah.
John gave us a little bit of an
Okay,
update on
great.
that, but not as detailed as what you just
Alright.
shared. He just said it's been difficult,
Yeah,
so.
yeah, and right now, there's probably not a timeline on that 0.25. Maybe by the end of summer, but it doesn't appear that it's gonna hold up our restoration.
Right.
Anything that
Yeah.
holds up the restoration is on our end, right, Melissa, not, has nothing to do with that 0.25.
Yeah. Yeah. The last, it seemed like for a while, there was, kind of a holdup. There was no agreed, way to get around this. It's like the wrong name is on the title. And so it seemed like there's some, positive movement, like they've agreed on a method for getting that worked out. So that should move it forward.
Amazing,
We're always optimistic.
water
about
owner was allowed to ride his ATV on the tundra to maintain his ditch.
Yeah,
I had a real problem with that. Just,
that was part of our right of way.
yeah, I had a problem with that.
I think that looks like that's often, a part of a ditch right of way
Yeah, I didn't.
everywhere across the west.
I was shocked. I'm thrilled what you guys are doing. It's awesome.
Thanks.
Yep.
This is a great photo. Man, really good photo. Lisa must have. Did you take
It's
the
just off
picture?
of
Is this
Zoom. I
clear?
mean, off of Visual.
This is nice, showing just really highlighting the need for that erosion control up at the Red Cloud. So, any questions on that project?
Is the creek just coming right down below that dump right there? Is that the?
It's right
See,
here.
No, go to the right. There looks like another drainage, right there. Oh, is that a drainage also?
Well, it's really just metal migration causing that defined.
Oh, it
kind
is, okay.
of Erosion, yeah.
So if you do some work there, maybe that'll.
We'd like
would
to
be
close
res-
that
Would be
vegetation up.
restored that, okay.
Yeah. We're
Interesting.
just gonna look for opportunities to slow down water at every possible point, whether it's
Okay.
on the road or
Here, and here.
in the little,
That was a really dangerous area about 4 years ago, with all the open shafts.
Oh, no kidding.
It was-
Yeah,
it
but
was- There was a lot. It's a nice ski right there, Oxen. Just thought I'd let you know, Holt Mountain, nice ski.
not, I was up there not too long ago and there wasn't much snow there.
Is that right?
Really?
It all got blown off.
Oh, really?
Oh.
It was not looking too snowy.
Oh, just another, this was just another, map to show the Fen area that we're gonna be working on. I think you guys are familiar with that project. We've talked about that for a couple of years now, I think. Or I
You
feel
guys
like,
You restored that ditch that's just above that red area, right? Didn't you guys do that where Gibbs? Hillside right there and stuff?
Yeah, and it is looking spectacular. It's,
Good.
yeah, it's noticeably filling, like we're catching sediment really well in those check dams and vegetation's really taking hold.
Wow.
Looks really good.
Were you guys
Yeah.
aware of that, not only do you have the Mineral Point ditch down here, but then, put the ditch right through the dump and then went up the hillside to catch as much as they possibly could, even more, just put a ditch up through the tundra, and I'm always shocked by that. But you guys have done a nice job on that, so.
yeah, Lisa's been taking good care of that. This is that Vermilion Tunnel, the hotspot removal. So we're gonna be, let me see.
Is that below the road, you guys?
Yeah, I think the next couple of maps will illustrate that better, more so.
Hotspot
Okay.
meaning lead or,
Yeah, there's some arsenic there, but there is a spot there that's at 80,000 parts per million lead.
What are you gonna do with the stuff? Just cover it or?
We've got another slide here to show
Okay.
you.
So this slide highlights, yeah, this is the road right here. We'll be doing the work right below the road, and it's just a small area where there's tailings that are in this wetland area that we're gonna remove.
You're not
And
gonna, I see that circle is much bigger. You are gonna leave the wetlands alone, aren't you? Okay.
yes, yeah.
We're also not touching the discharge that's actually coming out of the tunnel. It's actually really good water quality and even.
And it
though
drains pretty well off to the side there.
Yeah, it's in pretty good shape,
Yeah,
but it's also not on BLM.
right. So, yeah, we're also gonna be taking out, there's a cabin, I think it was built in trespass on public land. And it has since collapsed and now, it's getting, dragged across the landscape by, so we're gonna have that removed and hauled off, to the landfill. And that's about in this footprint. Is it
So that
close
was
to?
a trespass cabin.
Yeah.
I'll be darned. Huh.
Yeah. So we'll be getting rid of that. And we're going to take the material from, the Vermilion Tunnel area, and we will be building a small waste consolidation area in this footprint of the road where it's not really used anymore. So we're just going to be there will be a road accessing up to here probably. But at that point, where the road is already naturally kind of revegetating, we're going to be building a small waste consolidation area. We'll treat the waste that we're burying with lime, get it to a neutral pH, and then contour it into the cut from the road. And that work will be done this fall, and there will be a requirement for. We would like to close the road. Let me see if I have.
Those will be spot closures.
Yeah, right. It won't be a full closure for any long period of time or anything. It'll just be, management of equipment basically is what we'll be doing. So Lisa, this is a great photo, focusing in on the, the bulk of what the work is going to really look like. Excavating this, mostly it's the white material here, and taking that out, and then we'll be re-vegging the whole area. And
We have
we're
a pothole there, but we don't expect it to be very deep.
Do you have any lead values in the water in there?
It doesn't appear to show up,
So it's
really.
not transported.
Yeah, you can see it in the vegetation as you go down below where this picture is at. But then once you reach the water, you don't see it anymore. And maybe during a storm event, but we don't have evidence of that.
Again, like, how many of these projects you gonna do? I mean, you could go to every mine dump in San Juan County and find lead. You're not gonna mediate every single one of those, because they're historic, they're mine dumps. I mean, how far are you guys gonna go on this, as far as digging up all these historic sites?
Well, when you have 80,000 parts per million lead, I mean, we have a responsibility with that, so.
Cause you think people are gonna camp, they're not gonna camp there.
Well, I think because one thing, I would say because we're within the Peak Mining District, you know, that really alters things for BLM.
One
Yeah.
number, I mean, 48 sites. Sorry, just.
This is, yeah, this is not one of those
But we
48.
would actually probably be doing this whether we were listed or not, you know, so that
Yeah.
was why the AML program started, is to do these
Yeah.
types of projects.
But you're not, like, I'm just being a devil's advocate, you're not gonna go after the dump someday just because you found a bunch of lead in the dump, are you?
No, but if it was on BLM, I think, who knows, I mean, archaeologically, we can't go or we can't affect dumps very much because of their archaeological value.
So
But-
the dump itself does have archaeological value, because that's what I'm worried about. I remember a former EPA person here about 40 years ago that said if I had my way, every mine dump in this county would disappear.
Yeah.
And that's not right. That's our history. That's why people are coming here is to poke around looking for rocks, to look at the history, look at the little buildings that might be there. So don't even start thinking like that.
They are considered a contributing feature of a site typically, not always, but.
Okay. But they should be.
Yep.
And just, I mean, I understand the high lead concentrations, but there is, as far as water hazards, it doesn't seem like there is. Okay.
Yeah, I also think it's maybe important to point out that BLM, of course, wants to improve water quality, but that's not where our responsibility ends. We also want to improve terrestrial habitat and of course, human health exposure, but terrestrial habitat is
Sure,
on our
I could see that.
list.
Anything of historic value on that site?
There is some outside of the circle, but not within the circle.
Just wondering where the boarding house was. And I
Oh.
don't remember a mill.
Know that.
Where was the boarding house? I mean, it's a terrible spot to put a mine because they have one space, but.
I'm not sure if we know that.
Okay.
No.
You're welcome to come on site sometime.
I haven't looked at that in a long time.
Yeah, we did modify this project a little bit. We did want to do, there's a little bit of BLM up here, but this is really, really steep and the cost would increase quite a bit to do work in that area. Also there's a lot of, that may be what you're talking about. Scott, the archaeologists were very concerned too with work in that area. So we just kind of focused the project on an easier, cheaper option here. So.
And
Yeah.
this stuff is just gonna be dumped on the road. Are you destroying tundra to each side of the road to do this on
No.
that dump site? Or are you just gonna dump it right in the middle of the road and kind of bury it there?
We'll dig in the road a little bit.
Right. But
And our specialists have defined our space very carefully that it has to be within the width of the road. And we can't
That's
go into
awesome.
vegetation.
no, that's great, because I just worry about these projects
Yeah.
destroying more than they actually.
Yeah, that was our wildlife specialist was really particular about
No,
not
that's
going into the
that's-
green whatsoever.
That's great.
And we were having a hard time finding it, WCA or waste containment area for this site.
It's a good solution.
Yeah, I think so too.
Okay. So this project is actually, typically we're working with with Northwind, but BLM has it's like a hazmat construction IDIQ. And we have two different contractors that we work with. You know, we get a project, we send it to both, it's Applied Intellect and Northwind. And Northwind does win a lot of our projects because of their experience here in Bonita Peak. But this project was awarded to Applied Intellect, and they are subbing out environmental ER, the folks that EPA uses quite a bit in the area. So this is a little bit of a different crew for us this year, but we expect, of course, it's the same. We're still the same, so expect the same great, work on the ground. They did put a really nice traffic control proposal together for us in their work plan this year. And so we are going to be needing to bring in some borrow material from off-site. And so I think, and then mobilizing equipment to the site will have to come up through Animas Forks. The borrow material is coming from the Silver Wing area. There's a slide. What Lisa and I were saying, free refills right there across from the Silver Wing, but it's in the county road. And so we will, the crew plans to get that material early in the morning before traffic, really builds up on the Alpine Loop. And then there will be flaggers along the road. I was showing you this distance here when they're moving material between this area and this area. It's not quite a half mile. There will be flaggers present during work. I think the only time they are using smaller equipment. So hopefully that accommodates like a passing zone, but where there's not a wide enough portions of the road, we'll have to, flag and just have people stop and wait for the equipment to move back and forth along the road.
What kind of trucks are you using?
I have to
That
go.
borrow area across from the Silver Wing.
We've got really small dump trucks. There, and I think it's the swivel one, where you
The
can.
tracked ones,
Yep, I think so, and you can turn it back and forth.
and they're pretty narrow, and so it's not gonna impede traffic too much.
You're grabbing the
It's
material
fine.
that's on the Voltec side, on the really steep slope.
Yeah, I got you.
Okay, that makes
Isn't that a
sense.
nice spot?
Good
Yeah.
spot, yeah.
Okay, so
I have a question for the commissioners. Should there be signs even like farther down warning people there could be delays in California Gulch? Like if you're coming all the way from, like, say, Gladstone, you don't want to wait an hour coming over a hurricane and then California, you're going to get stuck there. So should there be a sign almost like a Gladstone and a sign at Eureka where people know that there could be some delays in California Gulch?
I guess that's another question, is what time of year, is this a fall project? Okay, so not a July through September project, which is,
better.
which is cool.
It probably will be September.
That's a,
Okay.
Yeah.
September's still pretty busy.
it is.
Yeah, but not.
Not like July or August.
No, not July, August, no.
But
No.
I'm not sure that County Road 9 is really an alternate route for 19.
it's, Placer Gulch.
Placer Gulch isn't really an alternate.
It's not an alternate route, because it puts them back below Animas Forks. It doesn't get them to Lake Como or Hurricane or anything, so there is no alternate
good
route,
point.
really.
Yeah, we probably should have that.
Look at that.
Yeah, I mean, I think just saying delays on County Road 19.
Yeah,
And I wouldn't just say County Road 19, I'd say California Gulch. 'Cause
right.
Yeah.
I can't even tell you where County Road 19
Yeah,
was.
that's good.
Yeah, that's why I'm looking it up here on my thing, I'm
Yeah.
like, so County Road 9, that's Placer Gulch, right? So yeah.
Yeah.
Yeah, just,
And I don't
Yeah.
anticipate, I think 60 minutes is gonna be rare. I bet it's more.
But if I went up there in my Jeep and had to wait for 60 minutes, I'd be ticked. Especially if I had to drive all the way back over
Yeah.
California and hurricane.
I mean,
Yeah.
following
That's why you say the warning
caravans of
Yeah,
Yeah, I
overland
agree with you
routes
on
or
that side.
ATVs is no different than for construction, like. I was up there last year and God, there was the. Up by Lake Como, I think we had to wait for
Oh.
about 45 minutes.
for the
Total.
people coming over California Pass there or?
Yeah,
Really?
coming, well, we were following them, so every time we'd wait 15 minutes and let them go ahead, and then we'd catch up to them 5 minutes later because they were going 5 miles an hour.
But then passing you at 40,
Well, I mean, we were in a little like sand rail kind of thing, so we're not going fast, but we're not going 5 miles an hour either. It doesn't take much for those groups to be really slow, and if they decide to pull over somewhere and I'll take pictures, then. I made
What time is Tyler on?
11:30.
Very,
Yeah.
well, let's keep going.
run through it,
Yeah.
yeah.
Okay. Do you think it would be a good idea to put something down lower? Just highlighting that there may be delays in California Gulch, or we're,
Maybe all the way down at Eureka.
Eureka and
Yeah.
Gladstone.
Yeah,
Yeah.
Eureka
Let
and
'em know.
Gladstone are probably better than, and then
Yeah.
the flaggers ahead at. Other places, well, you kind of need that other one there at the junction of like, California
Mhm.
Hurricane 2, where it is in the left there.
Or even at Anima Sports, just
okay.
Yeah, just 'cause,
Communication there is gonna be tough though, unless they've got good satellite, which is rare, right now. The radios can't talk outside of that gulch.
oh, I think it's fine, just to sign warning people so that they
Yeah.
don't, get all the way over there and.
Okay.
Your first indication that you're gonna have a 30 to 60 minute delay at the top of,
Right.
California Pass is a
Yeah.
little far out.
Yeah,
But and honestly, Anima Sports is probably fine, because you can. Make alternate routes and do alternate things there, but
I think
if you,
Eureka would be.
if you set out to go do that kind of loose. Back to Eureka, it could change people's minds, especially if you're out there and it's rainy and you're in a
Yeah,
non-closed vehicle.
and this should be a relatively short project.
Mhm.
Oh,
Yeah.
good.
I would bet we are really only removing things for a week.
Yeah,
Yeah.
yeah,
It is
That makes a big difference.
yeah,
Mhm. Just a couple
The
days.
WCA might take a little bit longer to, construct, but.
Right.
yeah.
Okay. Okay, and we'll keep you guys in the loop on this, of course, when they'll be out there on the ground. We did already talk about Forest Queen. If you have any other questions, let us know. We will, because there is, we will have to have that road required when we're drilling. We'll have to have that road closed, so we'll be in touch on that for sure. Not the main.
This is just a comment, but there's a lot more important projects in the Forest Queen. I personally would drop it.
Yeah.
That's my own opinion.
Think of the history on that one.
I can't, as far as BLM.
I mean,
there's
they're
more-
back to Bill
there-
Simons
there's-
and
There's
I forget her name, the nice lady Stephanie.
the
Odell.
bacteria.
Yeah, that's
There's
a year or
more,
two ago.
there's more history, more government history on that property than there is the actual mine history. I don't even know.
There you go.
I think that, I would agree with that. That's true.
Sorry.
All right, this is the mammoth, the location of the mammoth. Great photo. This pond has now been, substantially increased, and then this one is dry. The water has been diverted away from it. I know it's not dry right now, but we'll wait for it to dry out and then get in there. That shouldn't take too long this year either.
Are you guys just gonna remove the sludge, put it somewhere and then just, level it out and revegetate it?
We're leaving it on site. We've taken T-clip samples there and it's good.
You're just gonna leave the
We'll
pond as
mix
is?
it. We'll mix it with some lime, but we'll leave it on site and then cover it. Contour it to keep water away from it and re-veg it.
So that hole will disappear then?
Yeah.
Good, I think that's a neat project.
Here's a quick look at all of the BLM. These are the designated dispersed campsites along the Alpine Loop. So we'll do work not only in the Silverton area, but also up and over the pass on these campsites. This is Lisa's the Cunningham Gulch Beaver Dam Analog Project. Do you want this slide to describe, or there's another one right next to it?
No, this is great. So right now, we've gone to a two-phase project here because we want to watch the reaction of the first phase before we continue on up next to the campground. So you can see that complexes are numbered there we'll put BDAs and PALs in from 5 down. And
Where's that starting at the bottom? What location? Give me just some reference to where the bottom is right there. Lisa.
you know where that last established campsite is?
By the,
before you
sheep-
get
by
up
the
to Highland
sheep, by the
Mary.
sheep corrals? Is that where the sheep corrals is? Where's the sheep corrals?
Sheep corrals are right there.
Oh, okay, I was
So-
turned around,
Oh,
okay.
yeah, going
Yeah, yeah.
uphill.
Highland Mary is that down, that's
Yeah.
the tailings pond down there.
That's
Gotcha,
right.
okay, sorry.
And, yeah, so these ones will wait, observe, and then, continue with phase 2.
Aren't the beavers already doing a whole bunch of stuff up there anyway?
They are doing
Yeah,
good.
Yeah, there's some big dams that have been built in the last 5 years up there.
Yeah, I really, this project, rose to one of our, top. We looked at all the different gulches for putting BDAs in, and this was our, like, top project area. There's all sorts of criteria that come into that. So we really are happy to have beavers there. That's one of the things that you look for, is to have beavers present, and then they can, maintain the structures that you're building. So they're just gonna be able to spread it out, and if we get done with phase 2, it looks like we could go from hydrating right now, there's about 8 acres hydrated. It could increase to 18 with a full project. So it's a pretty big increase.
And that water goes beyond the ponds too, I mean, it's spreading out the water table much farther.
Yeah, yeah, should really
Yeah.
be a response to your
Yeah.
vegetation there.
That's awesome.
Um,
And that stretch of creek has never been that high in metals, has it?
No,
Amazingly, I mean, because there's a lot of mineralization, but it's just, I don't remember, I think part of it is because there's so much limestone
yeah,
right there, I think that's.
totally different
raising
geology,
The
yeah.
pH.
Yeah. And this is a different funding source too. This is the bill funding, which has a lot of that funding was given to us for focus on restoration of riparian areas. So it's a little bit of a different kind of funding than we're usually working with. So. The Animus Forks, our hotspot removal discussion. We have, of course, we've talked more about archaeology at this site than we have talked about, the contamination and human health issues. Internally at BLM for sure. But this summer or as spring, as soon as we can get up there, the archaeologists want to do some investigation. So I think they're going to be like digging, and they are going to be getting in touch with the historical society folks before they go up there and do that. So we don't have it.
How far are you digging down on that? for that lead, not very far.
No, and we haven't even been approved to dig yet.
Yeah.
We have to wait till the archaeologists do their investigation.
I was just, Willie suggested, the one last time we talked about it. Isn't it an area you can't cap it with good topsoil or something instead of digging?
Well, some of the archaeologists are against that as well. It's just we're gonna have
But then you
to
can-
wait and get everyone's input before we can
alright.
actually determine the.
Tell your archaeologist to grab Will Myrick's book, Animal Sport,
Yeah, that's-
which has great maps and I even left with Will measuring, for his maps and stuff like that.
Is there a local place to buy that book?
There is. It's
So-
more information about animal sports and the other, what's cool about that book is it covers the surrounding area, Placer, California. Going up towards Engineer because so much of the world is being brought down to animal sports and stuff, so it covers a lot of history. It's a pretty good book. But you're really gonna wanna read it.
Yeah, I would just like to, once you're done with it, I just like to see your plan of what you're doing with it. You know,
Well,
how you're-
hopefully you will, before there's a plan, you will be on
Awesome.
site with your input.
Awesome.
Yeah.
Yeah. We know what we wanna do.
Yeah.
But that isn't necessarily gonna fly. Yeah.
Right.
Okay.
We're working on it.
Put a souvenir store right on.
Maybe, we'll see. We have talked
Yeah.
on, so at this site, because we do have, that area. So what we did last year, we identified these areas that had like 12 to almost $50,000, or not $1,000, 12 to 15,000 parts per million lead concentrations in the soil. In that footprint, kind of where people had the picnic area. And we went up there and we moved the picnic area out of the way and we put some rocks in, so that people weren't driving in there to kind of deter that, foot traffic in that area. And we have, I don't know, we've been asked about putting up signs in the area. Because we know that we have areas with that high concentration of lead. Should we is it responsible of us to be putting up some kind of signage to notify the public that this is an area with higher concentrations of lead? And so, I'm not sure what the answer to that is. And we would be open to a discussion with you guys about, if you want to see those kinds of signs up there, or should we can maybe do something more this year to try to deter people from that area, keep them out of there, make sure the picnic table doesn't get put back in there.
I don't think it's hurt any tourists over the last 100 years.
Yeah.
Standing on that site.
I think the medical records speak for themselves. On this, I would hate to see signs in there. I mean, deterring is one thing, but putting signs in there.
Yeah, put a skull and crossbones on.
How many-
So that's good.
How many sandwiches have been eaten at that picnic table?
And,
That's tough
I mean, if
one
you're
for me.
that worried about it, just put a little split rail fence around it and that's it.
Yeah.
Does that seem like we don't know, and we want direction from you. You guys are more comfortable with fencing than you are signage, or is there a balance there, or? I don't know, or a message that you are comfortable with? Or you can think on it. But we do wonder if we need to do something this year, since we did our sampling last
Just
year.
It's just not that big of a order.
Mhm.
I mean, it's just-
Yeah,
But if you were the landowner, how would you feel then if you had 47,000 parts per million there, like, and that people were eating on, like, then it puts you in a little different spot?
They're only there for an hour.
if that, yeah, I
They're
mean,
not
if
eating-
the kids aren't, if the
they're
kids aren't,
Your
if-
kid eating
They're eating peanut butter sandwiches, not lead.
wouldn't bother me a bit.
I probably just wouldn't want her in like eating the dirt.
Yeah, as long as they're not taking their spoon and putting it in their cereal.
That
I'm
on
good with
many
it.
a dump, our lunches.
Yeah.
We have, I mean, it's just, I think it's. Some of it's, It's too much, guys.
I'm more comfortable with that than with drinking out of our lead-filled municipal pipes, you know?
There you go.
Okay,
Well, that's interesting for us to think about, Melissa, and.
Where'd you guys move
Yeah.
the picnic table to?
yeah, we,
The foundation there that you can see real visible
Okay.
with the two lanes, and that was where we had decent
Okay,
numbers.
but
of-
just nowhere near buildings, because then you attract rodents, which destroy buildings and.
No, it's in that flat area above it.
Okay,
is it right
Yeah.
here?
No, it's out.
There's this spot here.
It's
I mean,
right there.
even just put it, like if you put a couple picnic tables where it isn't, I think that's gonna attract people away from that area.
Yeah.
If you block
Yeah.
that area with rocks so they can't park
Yeah.
there. And then put a couple picnic tables in other spots, they're gonna flock to those in a safe spot, I don't even think. Cause there's nothing
Yeah.
interesting right there,
Yeah.
you know, to go look at, they're gonna head to
Yeah.
the mill, or usually they'll just head for the bay window house. And the buildings, they're not, a lot of them don't even go across.
Yeah, almost got moving tables around doesn't bother me.
Yeah, as long as it's not too close to buildings, you know. From down by the outhouse there.
Okay,
There's some really hot spots.
we'll just be careful. Yeah,
Down by the outhouse, really.
Yeah, they're small, but they're there.
That's
And we're proposing to kind of vacuum those two sites
Wow.
I just
because
had-
they're very hot.
I just had a picture of you with a floor mat. It's like, boy, you're taking it too far.
You
But our
talking
archaeologists have
hydrovacs?
Single
You're
thing.
talking about hydrovac trucks?
It's not a hydrovac, but it does.
Do the same
vacuum
thing,
wet.
okay.
It can't go down very far.
No, it's gotta be
Yeah.
very shallow,
Yeah.
but we don't have permission to, dig and find out, so.
okay. How many more slides? So we've gone 15 over. Do you want us to book another time to talk about the rest of these projects, or should we keep going? I don't
This
know
is
what.
the last three, isn't it, on the list?
Yeah, there's just a few more slides here. So, all right,
It's
well,
gonna
power
take some
through.
talking though, probably.
If this is gonna take some time, let's do it another time.
Yeah, you guys mind booking another time?
No, but,
We like being busy.
What-
Okay.
what-
Yeah.
No, we can do that.
What's the rule?
that's on the
Is that
other
okay
side of
with
the
you, Will?
engineer. And just before you get into Timberline, it's just below the road,
Huh,
out of sight, just out of sight. In between the Wyoming and the road.
okay,
Exactly.
yeah.
Yeah.
well, that puts some-
I think we can, I had one or two other things I wanted to talk to you guys about, just. That weren't on the slides too, the first one's just at the Columbus, are you guys all done at the Columbus now?
That is DRMS doing that work
Oh.
on private, well, on Historical Society.
Yeah.
Actually.
Yeah. Okay,
But yeah, as far as
Wasn't
we
my- that
know,
wasn't my
yeah, complete,
okay.
yeah. Was there something
Well,
more that you wanted there?
Where your guys' project was before, I mean, we had talked about, maybe placing some boulders and stuff and trying to make sure that people were staying off of that area, or which,
She
am I
did place
in the right
boulders, didn't
spot?
You guys already did that, didn't you?
Yeah,
Yeah, okay, just, we had some funding for boulders,
Oh,
and
that's
if you guys had to pay for boulders, if you get us an invoice. Okay, yeah, alright, okay, alright,
actually, she ended up getting most of them on site.
yeah, I figured that was probably the case, but just, yeah, we could reimburse you if you had to pay for some, but.
You can bring it up with Kirsten if you.
Yeah.
She needs it.
And then the other thing that I just kind of wanted, well, with some of you guys in the room here, was the potential restroom location in Gladstone that we had talked about. We'll have Megan here.
That's right.
It was, yeah, I know, probably not on your guys' project. It looked a little, the proposed location is kind of there across from like Dry Gulch. And we were wondering like how much, effort has gone into planning that so far. I'll pull it right up here if I can, so.
It has not been, introduced to our, IB team yet, for any of that analysis, we're still.
Are we on a time frame on, as far as use of that money, Austin?
I think we have a couple years,
Okay.
so far, so I just, man, of course, I'm way off now. I tried to use the search function and that didn't work out.
Is that kind of,
110.
well, 110, but then.
Yeah.
By
30,
35,
yeah,
yeah.
35, that's, so that, like, that's the road that goes up to Prospect.
Prospect.
Starts at the bottom of Dry Gulch there. And just, we had thought, with how traffic that area is, especially even in the winter time, that maybe closer to like Gladstone itself there. And I know it's challenging with the landowner issues there, but I was looking at the maps and kind of like right there in the parking lot where everybody parks for Minnehaha. There seems like a good chunk of BLM land there, maybe on the southern end of that parking
It's a
space.
tiny corner. And
Yeah.
it definitely goes into that parking lot, and I think the direction I got from you all last year was you didn't want to lose real estate in that parking lot, but I'm happy to consider that. If we can find enough BLM to do it on.
Yeah. I know it's tough with the issues there. but-
The ideal location would be right where Corkscrew starts up, because that's where most of the traffic.
Well,
is
that's,
going,
but that's where that parking lot is, basically.
Oh, I thought you were talking about.
No, on the other side by on the mill side, you're talking about, right? On the mill side?
Mill side by the mobile mill there, but that's private property,
Yeah.
but that is the ideal spot.
Yeah, it is the ideal spot, but
And there's kind of
I
like,
know we're talking about,
Yeah,
But I'm happy to sit down with somebody and we can kind of like.
Yeah.
Around and see if we can come up with a suitable
there's
location.
like the bags right there, and then this
Yeah.
little chunk right here, just kind of the southern
So,
end
like,
of that.
Right
there.
where the kiosks are currently.
Yeah, and then there's like. the
Yeah, I mean,
Trees and stuff like that. I mean, I hate to, take out the parking and the staging there, but. I mean, having a bathroom there is a pretty.
Yeah.
It's a better amenity than
Exactly.
parking.
An easy one to get.
So
Yeah.
yeah, so sorry if we gave you bad
oh, no, it's okay.
direction before, but.
That's great.
Yeah.
Yeah, I think that site is a lot more impacted than the other site at Dry Gulch.
Yeah.
So it would be easier to get
Yeah.
through our process.
Yeah,
So, yeah, I'll go down
cool.
that.
Cool.
Yeah.
Are you finished, Austin? Cause I have.
Yeah, just, yep, that was all I had, yeah.
I've been going through, Zeke's, archives. And I have come across a beautiful cross-sectional map of the Bandoras, which we took Zeke's map cases, in the archives. And on those new map cases back in that back corner of the archives, I've laid out that Bandora map. Because I think that's one, if you guys can do it, well, it's not you guys, it's EPA was gonna do more drilling up there, trying to locate that tunnel. It's a really good map.
Yeah, we'll do that ASAP.
Yep, so,
I wonder, do you think that Zeke's maps should
yeah,
like supersede everything else? Or
there's
if you had a good look?
there's at least one whole box of Sunnyside maps. So they may be, I'm sure some of them are duplicates, but there is one whole box of Sunnyside maps. The rest are, like Red Mountain, some Red Mountain stuff, the Rouville, the Guston, that area on there, but I had one whole box is Sunnyside. There's a good one of Sulphur Mountain, some very old ones, a couple old ones, but I did lay that Bandora one out on purpose on back of the map case for you guys.
Okay, great.
All right, and then this might be a question for Megan. I did take a photo of who are the snowcat guys that are up on Mollis, what's the name of their company?
powder cast.
Powder Cats. I want you to see this picture because it's something I've showed pictures before, but this is the damage that's being done to the tundra, right where they take off the road. You can see their tracks are going right into the dirt there, and that's all tundra right there. The snow is too shallow right there because it's a big southern exposure. There's this picture of the damage. Right there. Yeah, so
I can see it pretty good.
they're going down the dirt right there. So I think you guys should look at that, either have them do a different route.
Relocation.
Or something, like a zigzag or something, but just just going straight up that slope like that, when the snow's shallow, they're trashing the thunder right there, so just an observation.
I'll let the Forest Service know, they're
Okay.
permitted to the Forest Service, but not the.
I thought your little sliver might be right, I know there's a sliver of BLM land in there too, I thought that might be you guys, but that's, but yeah, if you would,
But, yeah.
okay, that would be great, all right.
I'm good.
No,
I think another session would be great.
That really helps us a lot.
Yeah, what you haven't seen yet is San Juan Chief, which we have some pretty major plans there that we need to talk to you about, and then we have Lloyd Parade and other stuff on the other side there. The closures, and one more thing. But anyway, so we should.
Yeah.
Should we do another time right now?
You know, our next meeting is in 2 weeks, it's an evening meeting, if that works, or the, day meeting in May, so whichever works for you guys, I'll just put you on the agenda for that time, so.
You good for an evening in 2 weeks, Melissa?
Yep. Let's make sure. Which evening? The 24th?
Yeah.
Ooh, I might have to be on Zoom, is that right? I think they're
So Wednesday,
The one thing I will mention, and we mentioned earlier, if we could get a printout of all those projects, that would be awesome,
Okay,
just to have them.
yeah, but.
Do you still have that, like Lisa had filled out those forms in the past? Do you still have that process?
Yeah, the
Or,
slideshow, whichever,
Yeah, you
or
can
the slideshow, you
email us.
whichever's easiest, yeah,
It'd be all right.
Yeah,
That's easy.
yeah.
easier than
Okay.
filling the modified land use form. Okay, we can do that rather than.
Oh, yeah, whatever's easiest for you.
Okay,
great. Okay, and so we will, it's the 24th. 6:30, is that when it usually is?
yes,
Okay,
Yeah,
I don't think I've got anything else scheduled, but I'll give you another time.
and,
Oh, yeah, you can bump us to the next meeting too, if you you don't have a whole meeting just for us.
and I'm supposed to meet with Louis on Friday. And go over all of the same stuff, so.
Excellent.
I asked him to be here today.
Appreciate
but
that.
He wasn't able to make it, so.
okay,
That,
one other thing, just as like a heads up to, Louis pretty concerned about heavy equipment and weight going over the Cunningham Bridge right now. With all the hauling that's mostly been happening with the EPA, but that might also affect hauling equipment across that bridge. We're gonna try and work with the EPA to see if we can redeck and repave that bridge this summer at some point too, but don't want it to affect your guys' project.
he's actually gonna put weight limit signs on it, just so you'll know,
Okay.
just so,
Good to know.
Yeah, that's kind of the weakest link in the road chain there, and he's starting to worry about that bridge failing with all the repetitive hauling going across it, so.
We'll have to mention that to Mark.
Mhm.
Yeah.
Yep.
all right.
Thanks,
Okay.
guys. Thanks for all your
Thank you,
time
guys.
today.
Thanks, Lisa.
Great input too.
It's really put in.
No worries.
All right, well, thank you guys very much.
Thank you.
Next, we're gonna welcome Tyler George from Silverton Ambulance Association to present.
Hi, guys.
Get approval for your renewal.
Yeah, this is the quick yearly license renewal. And just a few things before we start. So this is gonna be the last year that we come in front of you to get a license. CDPHE, the state has decided that they will be licensing ground ambulances for the foreseeable future. Yeah, well, we used their they put the regulations in place that we had to follow anyway, and then we would bring them to you and the county
Right.
commissioners
Yeah.
would approve them. Now, they're going to be approving them. So there's a couple of things. This license that we're gonna ask for today is just a temporary stopgap because the state is gonna be issuing those licenses in May and they'll go into effect July 1st. So this is just sort of a stopgap until they get into place. And then I spoke with Dennis. There's nothing that the county will have to do after this because they're not gonna be licensing other ground ambulance or.
Yeah, so basically there's some options that for counties that want to continue to license and add different things and all that, and speaking with Jim and Tyler and Willie, it just didn't seem appropriate to add any more layers to the licensing. And the state finally gonna do something.
There you go.
It's a funded mandate for them now.
We like it.
Well, we'll
So-
see how long it lasts, you know,
Yeah.
maybe they
Yeah.
kick it back in a couple of years, but.
Yeah.
So for today, typically, or I guess historically, what we've done is we prove that we have the following documents. We've got our medical director contract, EMS protocols, policies, procedures, rosters, and then our insurance, both per vehicle and our liability insurance. And copies of our ambulance inspection equipment and inventory. And I followed Kimmett's lead and usually printing out one copy of each of these things because of unless you guys want to read through them all.
We'll let you read through that.
Right, so this is our medical director contract. This is good through December of 2024. With Dr. Hughes, he's still our medical director. A copy of our current roster, which after we did our combination with search and rescue and the ambulance, we're sending a copy of this monthly now to Jim Donovan as the OEM, so we can keep our insurance up on all our people. So this is updated monthly. We have a copy of it here. We have insurance, proof of insurance for our ground ambulances. This is our liability insurance, medical protocols, and then we've got our ambulance checklist, and this is all the required equipment per the state that we have to carry on each of our ground ambulances. So we have one of each. Again, I'm more than happy to send everybody copies of all of this. Previously, nobody's asked for it. But yeah, so this is all I have for you today. And again, this is to get us through to the 1st of July when the state will be licensing us. And we've already started that process. We have all the paperwork turned in. The one thing that we do have to turn in is going to be an updated license from the county. Once they see that, they'll be able to process our application.
And then we have to, we actually have to file a opt out of the, there's a notice to proceed that if we still wanted to be involved in the licensing, they would have to come to the county and get a notice to proceed, or we can opt out of that. We're gonna opt out of that. I'm just waiting for the state to give me a form that they want us to use. The state's still in the teething process on this thing as well, I think.
Yeah.
But as soon as we can find out what form they want to receive that opt out in, then we'll set it up to them. And then there's a onboarding. I love the words that the states puts in place. There's an onboarding into the license requirements, and I already talked to Tyler. He was way ahead of the curve. Yeah, just so well organized. He's already with the state and onboarding and all that stuff. So super impressive.
Yeah, we thought we could get it all done in March until we found out they wouldn't start reviewing it until May 1st. So, yeah, hurry up and wait.
Typical waiting on them, yeah.
Yes, sir.
Willie, do you need a motion?
Yeah.
Okay, the licensing of our ambulances, or how do you want us to word that?
The year. I'm sorry.
No,
You're saying it's temporary, but I think.
But for the year.
It's
For the year.
Yeah, that's what we're gonna turn in. What we turn in will look the same as every previous year, and then they'll take it over in July 1st, but.
Yes, to be clear.
So, make a motion to approve the ambulance licensing as presented, is that good?
For 2020.
For 2024.
I'll second it.
All in favor?
Aye.
I have a couple questions.
Please.
Just
Absolutely.
general stuff here, like, just how crazy has your guys' insurance costs got compared to what we've seen for the county? You guys seen huge increases like we have?
No,
No.
no,
That's good news.
we haven't. We do have 2 vehicles that are insured by the county, that are county vehicles. But our liability, workman's comp, and our vehicle insurance, we've seen little increases, but they haven't been drastic.
Great.
So, and I was unaware of the county's big increases, so.
I mean, I think we're like looking in the last 5 years, I think it's like more than double.
Just my personal insurance has gone way up.
Yeah,
My business insurance.
yeah, for sure.
In fact, I couldn't even, mine's been canceled 2 years in a row. When I went to renew, it's been canceled 2 years in a row because of where we live.
A lot of it's been related to, law enforcement too.
Mhm.
Ours has,
Insurance
yeah.
has gone through the roof because of all the, lawsuits and things and settlements that have happened.
We're interested, and the Southwest RETAC meeting, which has all of the chiefs from surrounding counties, we're interested in seeing what happens after the verdict for the paramedics that worked on Elijah McClain. They're in prison, and that was a pretty big lawsuit, and we're interested to see if that changes anything for us. That verdict just came through, so we'll see if that changes anything moving forward.
Yeah.
They also were grossly negligent, so hopefully that doesn't affect everybody else, but
You guys aren't on a pool either, though. I mean, we're sort of stuck in
Yeah.
a pool situation.
Yeah, we are.
Yeah,
Yeah, it doesn't matter if it's Denver, Boulder, or us, or
Yeah.
wherever.
but I mean,
Feel the
insurance is, based on kind of these larger areas too, wildfire is a big concern that affects a whole lot of people. I'm glad that they're not posting the increases in insurance and trying to,
not yet.
diversify their income stream a little bit more,
Yeah.
increase everybody's to recoup costs, so that's great.
They're killing us.
And then just as far as some of the work that we did for the BSAR stuff, I'm just wondering if you had to submit any claims for either search and rescue members or the rescue staff as far as like workman's comp or that kind of stuff that we had. Just wondering if we participated and had to use that yet.
We haven't had to use it. Hopefully we don't have to use it, but no, we've been safe so far, so we haven't had to use that.
That's good.
And I will say Jim has helped us navigate, but Jim navigates a lot of because the rescue team is still covered when we're out on a rescue by the county insurance.
Yeah.
And so anything that does happen, which we haven't had, but we do call him immediately, and then we go through the county for those claims. And then anything that happens on the medical side, the ambulance insurance takes care of. So,
Yeah.
But we haven't had to file anything.
And I know that we've been fortunate,
Yeah.
not to have, a lot of, really traumatic, calls as far as like search and rescue is concerned, as much as we have recently, but have any of the mental health resources been utilized, or, do you guys feel more supported by having some of those resources from the state, or is that kind of still?
So we've had our own EAP in place for the past, I guess, 5 years now. And that's offered to everybody on our roster, ambulance side, search and rescue side. And most of our people use that, and that's Triad out of Grand Junction. And I get a report on that, but not of who used it, but how many of our staff have used it. But I think most of our people still use that because that's what they know, and that's what they're comfortable with using. They've used it in the past. I don't know of anybody that's been using the state resource.
Okay. All right. Let's just.
But yeah.
Glad it's there.
Yeah.
Well, I'm really glad this hybrid between search and rescue and the ambulance is working out. And I think it's just due a large part to you, and I'm willing to work through it with Jim. And if you run into glitches or anything, let's head them off at the pass.
Yes, sir.
I know it can be a little bit sticky. We talked about the fact that you have to delineate. If there is an injury, you have to delineate, okay, was that medical or was that search and rescue, and then assign it to the right carrier and stuff like that. But if there are any teething issues, please bring them up so we can correct it.
Of course. And as far as that's concerned, our number one priority is also our people's safety. So, in my time with the ambulance, we actually haven't had to file any claims, and I hope we can do that moving forward. Obviously, that's, we can't promise that, but that's, we do work really hard on that. So I'm hopeful that we don't have to figure out which one to report that to, but we'll be keeping you and Jim and in the loop and, yeah, again, hopefully we just don't have to explore that too much.
Well, nice work.
But yeah, and I will say also a lot of the surrounding counties have looked at our model and they want to wait a couple of years, but if it's continuing to work in a few years, a lot of them would like to try and duplicate our model here. Because as you all know, search and rescue isn't really funded in the state of Colorado very well. A lot of folks in the area have the same concerns that we have and the same limited resources. And so if this continues to work, we might be a model for a lot of other services in the region and the state. So,
It should be.
yeah.
And hopefully the state doesn't come in and mess it up with some regulations that, because that
Exactly.
would be so typical, you know.
It's tough because search and rescue is the domain as far as the state's concerned of the sheriff's department and the sheriff's authority, and the sheriff's association is gonna hold on to that with death threat. Not our sheriff.
No, we're very lucky.
We have a great relationship, but in other counties, I can see that being really
And
problematic.
and that's what I've
Big
spoken
battle.
to other people about. If you don't have the support of your sheriff, it's not gonna happen for you.
Well, and part of the trickiest part about putting together the MOU situation that allowed the hybrid was because the sheriff is supposed to have supervision and so that's what a lot of the trickiness of it was, but I think it worked out well. And
It's, yeah.
I was pushing to go a different way originally and Tyler pulled it back in, so I thought that was it was the right idea. It was the right decision.
Excellent. Anything else I can answer for anybody while I'm here?
Do we have a meeting tomorrow?
Yes, sir.
All right,
Yes, sir.
okay. Just making sure.
All right, guys.
All right, thank you, Tyler.
Thank you very much for everything. Thanks for all your support.
Personal, let me know about Billy.
Of course, as soon as I hear, I spoke to George on Saturday. Haven't heard yet.
Okay,
So
thank you.
obviously, we'll absolutely let you know.
Thank you.
Can I ask Pete a quick question?
Me?
Don't adjourn yet.
Yeah. Oh.
Sorry you had to wait.
Oh,
Yeah, sorry.
It's fine. Yeah, it's,
We usually there'll be a
I'm glad the
lot,
phone didn't go off.
yeah.
Did you hear our discourse about the cabin up on Kendall? You got a letter.
Yes, I did.
Okay, and what do you think about that? Because we didn't have your letter.
As I've explained to our people and what I'll say to everybody is, cabins built in dangerous areas, they need to make sure that they tell all of their guests that there is a good chance there will not be any EMS or rescue, because we won't send people out if it's dangerous.
Well, it's not.
And it's not up for debate, it's not.
Right.
It's just, we won't go. And the more of these cabins that build, and especially if they're having commercial interests, I think that's the number, that should be the first thing that they have to inform all clientele.
Yeah.
I think that's a good idea, Tom.
Because, yeah, again, it's, we can't put our team in danger because
No way.
we are a civilian service, and so our risk threshold is lower.
Yeah, I agree.
Yeah.
All right, thank you.
Are you guys on lunch? Are you guys?
Oh, yeah.
Almost.
Thank you very much. Have a good
All
day.
right, see you, Tyler. See you tomorrow.
We're gonna be moving on to commissioner and staff reports. Did you have?
I don't have any.
I-
We had our ribbon cutting, and that's the only thing I've had in between the last couple of weeks, so.
Yeah, I had our Southwest rural, commissioners meeting, but the only two people were Michelle from Uray and Ann Brown from San Miguel, and I think it should have lasted 10 minutes, but I think it lasted 30. We didn't really have much to talk about other than, election prospects for other commissioners and things. Yeah, that's all I really had.
Yeah, so it should be forever.
So I was back a quick record. I just brought this up with Pete and everyone knows Pete's company hauls coal and for the county, and that arrangement was in place way before that he became a commissioner.
Right,
And just, technically speaking, probably should abstain for approving bills when there's a bill in there to his company. That's the only thing I brought up. And then if, I know that coal, hauling might be done. But if you guys renew the coal hauling, then we should probably do a disclosure of some type that it's a contract between the county and one of the commissioners.
Anytime I'm on there, I can just recuse, right, or abstain.
Abstain from approving,
approving.
just that bill.
oh,
Yeah.
oh.
Just keeps out of trouble.
When we do bills and warrants.
Right,
Yeah.
I should have done that this morning.
Yeah, and it's, again, this contract, I don't wanna turn it into anything bigger than
Yeah.
it should be, but technically speaking. You
I
should,
shouldn't be voting on that.
just that one bill.
I mean, would you like us to revote on that?
I think just make a note that he abstains on that, approval of the
Yeah,
bill that
just-
goes to him, so,
Well, warrant number
yeah.
337, you know, I vote yes with an abstention on warrant number 387.
Thank you, and then.
There you go.
Everyone is fully aware, and it's been disclosed many times that Pete's company hauls coal for the county, and that arrangement's been in place for probably 10
Long
years.
time, yeah.
And if you renew it, technically, you can send a disclosure up to the state, if, and we'll talk about that.
I think I've had all my last load ever.
Oh,
Yeah, unless.
I think, from being, Willie will go into more explanation, I think it's
yeah.
over with,
Yeah, I don't think,
ever.
I don't.
In fact, if I would have known what I'd known, we wouldn't
We'll
even,
put it back together.
yeah, we would.
The one in the minor softball or the one here?
If I would,
Well, the one. I mean, this one is still here as a backup.
and I asked Colin, and he said, no, please bring me a load. If we would have known what we know now, I wouldn't have.
Oh, oh.
And this is also just, I've never sat down and you guys have gone to commissioner school and got refresher courses and all that stuff. If you guys ever want me to talk about, some of the intricacies of rules, they raised the gift limit to $75. Woohoo. Recently. But if you guys ever want me to give you a presentation, or if you have any confusion on what constitutes
I like that you educate us on that.
but if you want more from me, please let me know. I assume you guys have all been on boards and except Pete.
Well,
On the top board.
the town board, we had
Same rules,
some same.
similar rules,
Same,
yeah.
things.
If you ever want anything extra from me on stuff like that, let me know.
Yeah.
Easy. That's it.
All right. We were just discussing our lack of meetings in the last 2 weeks, for commissioner reports. We should probably have a public hearing or public comment, which I don't even think is on our agenda, but we need to have it. But yeah, so
You wanna do that?
if there are any members of the general public who would like to make any comment on this agenda or any items in the county related to county business, please speak now. Seeing none, we'll close public comment and move on to commissioner and staff reports. Scott and I were just discussing the lack of commissioner and staff, or the commissioner reports that we had, but yeah, did you have any meetings? or anything you wanted to
I
discuss?
do.
All right.
The AAA has been
You thought you were getting off easy. with all
Oh,
this,
boy,
Careful.
I've got that.
Careful on that one.
Yeah, no, I figured out that, it's a job, so, had a meeting and, things are going better and, we got, able to get, our local people here paid and things are going smoother and, we did have to get rid of a couple folks. And, things are smoother now, so that's all that's all I'll say. All right.
Good.
Without naming names.
Oh, that's a sticky one. That's.
Yeah, that's yeah. So, the only other thing I have is I have, casually talked to you guys all about this. Just to bring it up for maybe next week meeting, or actually even before that, actually. Maybe an exercise for you, actually, I talked to Anthony about it, but, the condition of the paved part of County Road 2 is not good.
It's really
Because of the
bad.
trucking, You've seen it, we've all been up it, it's getting worse, Willie's seen it. We just drove it the other day,
It's all in the shape of, dually.
dualies and trucks.
They-
And the reason I'm bringing this up now is because I have found out, I bet Austin knows this too, but the real contract for this whole next summer for Pond 4 is gonna, all the materials coming from Rocky Mountain Aggregates, Montrose. So it's coming all the way up. The town has set a fee, we have not. I was gonna bring up, I think for our pay portion, we should go along with their fee or something similar. To get reimbursed for that portion of the road,
So,
if
so when we adopted the road permitting regulation, what we have in there is a section for repetitive hauling, heavy hauling. And it allows us to set an administration fee based upon the cost to administer it, but then it also allows us to basically either require a bond and or a fee based upon the estimate of road damage. And so my suggestion, and I think I copied Austin on it, was we need to find out how many truck trips are gonna be estimated. And then we need to get approximate road damage costs or road, I guess, mitigation costs. And then figure out cost per truck trip and go to the EPA and say, you know, this is our fee schedule. And I cut and pasted it in there. Did you have any questions on that, Austin?
No, I just, I think that information changes a little bit of the conversation, and I know Anthony's having conversations with the EPA this week, maybe even today, about some of these issues too. So we've brought it up to the EPA, but they've said that they need something by May 1st from us.
that was actually more of my conversation is there, they gotta put a deadline on it.
Yeah.
So
And you said we have something in place already.
we don't have the ability to do the same kind of fees that a town or municipality does. Counties are under a little bit of a different animal, and so the county road permitting regulations that we put in place. That's going pretty far. Yeah, I mean, we're technically speaking, you're allowed to charge for overweight, oversized permitting, road permitting. And you're also able to recover damage to your roads. So if you look around the state, there aren't a lot of counties that actually do extra hauling fees.
Yeah.
I looked at San Miguel actually does. And so when I looked at one from my other county, I was like, yeah, I think we could do that. And I think the way we've set it up is enforceable. But I think we need to work within the parameters of the language that we set up. I don't think we can just, well, I don't want to say on the record. But I would have to look into whether we could simply adopt the same fee schedule as the town.
And I agree, we don't want this to be arbitrary, but the bottom line is, I've got real information that it's all coming, he's got the contract, it's all coming from Montrose, so it's happening.
No, we've got regulation in place that.
Right, no, I got it.
I mean, we literally could say, we want you to post a bond before you start hauling. And we're gonna bill against that bond for any road damage. I mean, we could do a lot of things under that current regulation. My suggestion was simply, we have to have Road and Bridge come up with an estimate of what they think it's gonna cost to mitigate the road damage caused by the number of truck trips that take place. And as long as we get that number and we give that to them with a citation to our regulation, I don't see why they wouldn't pay it.
So how do we deal with the road damage that's there now, which we know, like the thing is that, oh no, that's from the garbage trucks coming back through town loaded, and it's like, no, this damage didn't show up until you guys started this project.
So.
How do you, but we don't have video proof or anything like that.
So,
Or should we be discussing this in public or should this be executive?
no, I think right now we're okay.
Okay,
So we're entitled to go after road damage. The hard part about going after road damage is proving who did it. So one of the reasons that we put in place the road permitting was not necessarily to pull money, proactively, ahead of time. It was to, have people come to us before they start a heavy hauling project so that we can then establish the condition of the road before they start hauling, and then we can monitor it, for the duration of the hauling. And then if we notice damage caused by their hauling, then we can go back and say, here's your bill. Because before you couldn't prove it.
right.
So it's not really even, it wasn't really intended to necessarily get money up front. It was intended to get notice of all heavy hauling activities, repetitive hauling activities. And then go out there, take pictures of the road before they start, ask them, you know, what route are you gonna use? What time of the day are you gonna haul? How many truck trips are you gonna do? When is this project gonna start? When is this project gonna end? You get that all on your permit, and then you go out there on their route, make sure the route can sustain it, make sure the bridge is adequate to sustain it. And then monitor and then document the condition of all of the roads at that time. And then periodically go out there, see if they're doing damage, maybe reroute them. And then document any damage they've done, and at the end of or during the project, start sending them bills if you have to maintain the road.
So that covers us from now, but
Yeah.
how do we cover ourselves in the past?
I don't know if we can do it
Yeah, we
retroactively.
did it.
Can't,
Yeah.
but it's,
Yeah, we know what happened when they start doing that ditch. We know for a fact, but like you said, probably can't do it retroactively, right?
but we have brought it up with them though,
We have,
and saying.
that's right, that's right.
Look, you know, even though we can't prove it, we're pretty sure you.
Well, let's not say we can't prove it, because I mean, I possibly could prove it if you guys wanted me to look into it and all that. I don't want to talk specifically on the record about that. But that's the design of our current road permit is
Okay.
to establish and monitor. And it also allows us to bond. It also allows us to, proactively ask for fees up front.
Yes, the EPA is willing to pay for road damages and they wanna help support, you know. Like paying for the road, we just kinda need to work with them on what they. How they wanna see it paid and how we would like.
Cause
to
they're
support it.
getting ready to pay Taylor's Pond number 4, a big chunk of it. It's like, well, while you're doing that, why don't you pave our road?
Well, and they're just getting ready to start. They're gonna bring more low boys with more heavy equipment to start with up the Pond 4 on our road. Just that portion, that's the EPA portion, besides the aggregate.
Could we just go into executive session, to give legal advice? 24/6, 4024B for the purpose of receiving legal advice from counsel. It's my opinion that the matters are privileged, communication between attorney and client, therefore no minutes or recordings would be kept. If you could make a motion to do that.
I'll make a motion.
I'll second it.
All in favor?
Aye. So we gotta turn that off and we gotta.
Were you pretty much done with the meeting, or?
Yeah,
Yeah.
We're done.
We'll just have to log back in and adjourn, so.
We wanna